Resume our meeting. Is my microphone all right? Can you hear me? Tabled today is an earpiece. You can wear the earpiece. If you're not familiar with this operation, you can ask our colleagues, our staff members. Channel 0 is floor. Channel 1 is Cantonese. Channel 2 is English. As we have a tight schedule today, we can only accord 3 minutes to each deputation, including questions and answers for members. So we have to adhere to that strictly. I'd also like to remind you that your spoken remarks and written submissions are not covered and protected by the Electoral Powers and Privileges Ordinance. So please take note of that. Let's formally start. Secretary, are you all right? Can you continue? No problem, Chairman. All right. All right. Christian social work, Mr. Desai Kit. Thank you, Madam Chairman. During the last session, the deputations already mentioned that in as early as 2010, 65 deputations had their views on long-term welfare planning. On that day, the Secretary was not present at all. So today, I'm very pleased to see you. Today, we would mainly like to say that in terms of social welfare planning, C.Y. Leung has told a lot of lies. We'd like to tell the truth today. In his manifesto, C.Y. Leung said that he would have long-term social welfare planning. If you refer to the latest policy address, you'll see that he only said that he would adopt a flexible and pragmatic approach to plan for social welfare. Long-term planning and flexibility are completely different. Is also different from pragmatism. So he has cheated his electors. That's not my business. Number 2, Mr. Matthew Chung had been implementing block vote systems. He said that's a flexible approach. In fact, that's centralization of powers. The government will make the decisions alone. Besides, the government is establishing a lot of committees to cover up its policies and measures. District consultation, interaction, appropriateness, etc. were always mentioned by the Secretary. He always said he would like to provide appropriate services. I was at the district level and heard government officials. They're neither here nor there. So how can those measures and initiatives be appropriate? Another lie is that C.Y. Leung said that he would have specific objectives and targets. There would be specific indicators, timetable, and route map. But without timetable and route map, we cannot monitor the government whether it is providing appropriate services and policies. Upcoming, there will be 1,700 residential places for the elders. However, that undertaking was given in the past. This is not a new initiative in the new SARG, so the 1,700 residential places are not the contribution or achievements of this term of the SARG. So he is trying to use uncompleted homework of the past term to cover up himself. Our elders have to wait for almost 3 years before they can obtain a subvented residential place. Well, 3 minutes passed really too quickly. Next, PSWN, Mr. Stanley Ho. Mr. Chairman, members, good morning. We're social workers, students, scholars, and service users. We hope that we can maintain social work, people-oriented care, and these are core values. On the 22nd of August 2010, in the public hearing, we already shared with you our views on long-term welfare planning. In the past 13 years, the government is superstitious in believing in this so-called new freedom concept and this so-called flexibility in the block vote approach. So organizations have been competing for social resources. So the governance of welfare organizations declined, and the users have not been given sufficient attention. We don't believe in this false flexibility. There must be sustainability and stability. The last term of the SARG already shirked its responsibilities. 3 years after 3 years, is the government giving us confidence in long-term welfare planning? We have doubts. Now let's turn to past problems. On the one hand, the government evaded manpower and land planning issues. Many organizations decide on how funds should be used, and there are discrepancies. For example, in some organizations, the workload of 10 social workers were given to 5 social workers, and new welfare services would not be subvented by the organizations, not even officers. So services are bound to be affected, and there's no protection. And when service users and frontliners reflect these to the organizations, the reply is very often that the organization has the right to decide how to use the money. Flexibility on the part of organizations should be respected. But the government is using the excuse of flexibility to control the organizations. Departments and funds are set up to restrict the developments of organizations. Say today, Tin Shui Wai should get more services. Tomorrow, more effort should be put in anti-narcotics programs, etc., etc., and then you mention youth issues. So you're going round and round with these short-sighted makeshift measures. PSWN would like to have long-term welfare planning immediately. Frontliners, service users should be consulted, and C.Y. Leung must not go against his undertakings in his manifesto. Thank you. Next, academic for universal pension, Mr. Nicholas Chan. Thank you, Chairman. I'd like to talk about aging and universal retirement protection. The Census and Statistics Department came up with some latest data on aging. The situation is very poor. For single elders, the median wage per month is declining. From 2001 to 2011, there was a decline. Now it stands at $3,000 only. What does this indicate? This indicates that the aging problem of Hong Kong is very serious. Besides, in terms of retirement protection, the government has achieved nothing. It has wasted a great deal of time of Hong Kong people. In the policy address, the CE said that he has to study universal retirement protection. Studies after studies, they have wasted a great deal of time. We must, as soon as possible, implement universal retirement protection. Today, Hong Kong is a metropolis. It is a successful and prosperous society. However, there are so many elders on the streets. They're relying on picking up waste carton boxes for a livelihood. 0.537 is our Gini coefficient, which is very high. Is our government really doing something? Be it Matthew Cheung, Carrie Lam, or C.Y. Leung, they participated in this in the past. They were a part to this problem of poverty. We cannot drag this on further. Universal retirement protection must be adopted as soon as possible. A dedicated independent committee should be set up with a timetable and a route map. This should not be placed under the COP. This is retirement protection issue. Everybody of the 7 million people in our population faces this problem. The value of channeling resources to those who are in need is wrong. If that is correct, we won't end up now with 1 out of 3 elders being poor. So universal retirement protection must be implemented as soon as possible with a timetable and a route map, as well as a consultation exercise for feasibility. Next, Ms. Tang Wai-Chiu, Director of Hong Kong Social Workers General Union. Thank you, Chairman. In his manifesto, CY said that he is concerned about service development, manpower training, venues, etc. There should be medium and long-term planning. He also mentioned block vote implementation. However, all these are not found in the policy address. I hope that the officials won't just write the policy address. They should open wide their eyes and listen to our views. We do have expectations. We expect the government to reflect on itself. Last time, in August 2011, that is 1.5 years ago, we attended the public hearing. We raised 3 points. We commented on the SWET report with no dedication, no commitment, and no vision. Same for the government. In his manifesto, CY mentions a lot. Apparently, he has reflected on himself. However, the policy address reveals that he has no credibility. How can we trust that the government will have good governance? For commitment, we don't want privatization. The government mentions 5-year planning. It criticizes 5-year planning for lack of flexibility. That's an indication of no commitment. In the past decade or so, the government was wishy-washy in this. For a long time, we received complaints from the mental patients. Eventually, we got incidents after incidents. And we only got 20-odd integrated centers to handle the mentally ill. Now we don't even have enough land sites. We have not opened the promised number of centers. We don't have sufficient social workers. It's not that you say today you want how many social workers, you'll get them. Experienced social workers have to lead new social workers. When we lack money, we don't have money. When we need land, we don't have land. When we need people, we don't have people. This is planning. And all these have been mentioned in the past. And there's a lack of vision. So this is a very unsatisfactory scenario. The latest situation is that for the proposed voucher system, if you don't have enough manpower, it's not appropriate for you to launch the scheme. The scheme may assist the middle class, but the grassroots will suffer a lot. Next, Mr. Chan Man-Dun Ying, the executive member of Hong Kong Social Welfare Employees Association. Thank you, Chairman. We're a Social Welfare Employees Association. I'm Chan Man-Dun Ying. We were established in 2004 and were particularly concerned about the implementation of the block vote system and how the welfare sector had developed. All along, we've submitted our views through various avenues to the government. We commented on the policy address, for example. Today, we're here. We know that we'll only have a very short period of time to speak, but I came early to listen to other deputations. I won't repeat comments made. Well, government people are here. I'd like to tell them this. To implement social service or social welfare, before you do that, what beliefs should you have? If we don't have common beliefs, it's useless to talk about anything. For social welfare, tell me, do you think this is a commitment, a responsibility, or an endowment to those who are in need, or bestowal to those who are in need? You want social harmony? Or are you thinking that NGOs are financial burdens to you, costing you tens of billions of dollars per year? You have to clarify all these concepts and beliefs before we can have useful discussions. I think in the past, you're mainly on the negative side.
During the Chinese New Year period, usually we will have gathering and we will talk about what kind of meaningful services do we expect. But what we have discussed most is what we haven't been able to do, what we are disappointed about in our organization and with the government. We talked about services that we have not been able to provide, so we find it regrettable. I think in our sector, what is important is the passing down of experience. What we find saddening is when co-workers have accumulated 5 to 10 years of experience, they'll be forced to leave the sector because of remuneration or welfare. After we graduated, we want to set up our families. We realize that our ideal job is such that we cannot support our family, we cannot form our families, so we are forced to leave the industry or the sector. So I hope the government will face up to this issue. Please go back to a partnering relationship with all the other organizations so that we can move forward. Next, Hong Kong Blind Union, Mr. Wong Chun-hang, Vice President. Thank you, Chairman. Many public policies need planning and policy researchers. I think you are very familiar with this decision-making process. In the past decade, in the social welfare sector, we have been talking about the same issues, for example, lump sum grants, frontline workers, and so on. 20 years ago, we had social welfare policy white paper, but then 20 years later, today, the government is saying that with a plan, there will be a lack of flexibility, so there's not the need for a plan. Without a plan, where are we heading for? Without a plan, we will just be treating the symptoms. Today, groups A, B, and C will be saying that this is a problem. The government will invest some money. Tomorrow, groups A, B, C will raise another issue, and then the government will provide another sum of funds. And then Mr. Zhang will say to the LegCo that A, B, C, D, E, F, G have been done. At the end of the day, after these resources are spent, are those things needed by co-workers in the social welfare sector? Are we doing what we want to do? No. NGOs are also facing a lot of hard times. Every day, we have to strive for government resources. We have to try our best to identify different funds or strive for different resources to offer the necessary services. We have to package the services into forms that the government wants. For social welfare policies, are we talking about what the government wants or what the users want? Who is more important? If the government only adopts a top-down approach or a management mentality, the government wants to recover 120% of the cost in order to be cost-effective, then I hope the government can reflect upon the following. Is social welfare an investment? Do we really have to achieve the return that the government wants? Or do we want to use the resources to achieve social justice and to help the socially disadvantaged groups so that they can also have their lives? These are things that the government needs to reflect upon. 20 years ago, since there was a social welfare plan, why can't we have it today? Thank you, Mr. Wang. Next, Women Workers Cooperative, Ms. Sham Sui Kam. Thank you, Chairman. Our cooperative is formed by some grassroots workers, and we have worked for most part of our lives, and we are now in our middle age. 20-odd years ago, when our economy is being transformed, our job and our livelihood was affected. But then at that time, social welfare planning was backward. So for grassroots families, there's not enough protection. As a result, there is a lot of poverty of the working class. The government talks about 3 pillars, but there are a lot of problems. Not enough retirement protection can be offered to the grassrooters. Recently, there is the elderly living expenses allowance with means test, but then it cannot really alleviate poverty. We're of the view that the biggest lesson that the government should learn is that all along there is no territory-wide retirement protection. The first generation workers have become the poor elders today. We are facing an aging population, and the problem is getting more and more serious. The wealth gap is getting wider, so there should be a 3-party contribution, territory-wide retirement protection scheme, so that the earlier generation workers and all members of the public can be entitled to the life that they ought to have. Retirement protection is a right for each and every citizen. It is not a favor given by the government. The mid to long-term social welfare planning of the government must include an undertaking to the public. How can we have a universal retirement protection scheme and the associated roadmap and timetable? If the government doesn't make plan for a universal retirement protection scheme, then the grassroots middle-aged women workers will become poor elders tomorrow. Secretary, we don't want to repeat mistakes made in the past. I hope you will be very carefully handling this matter. Thank you. Next, Industrial Relations Institute, Ms. Lai Yun-mei. Thank you. Today we are discussing social welfare planning. We want to say that since the colonial era and 10-odd years after reunification, in terms of workers' protection and social security, the social welfare officers adopt a mentality of giving out favors. This is backward. The government only helps those who are most in need, those who cannot help themselves. But with this concept, the government has turned a blind eye to a long-term structural wealth gap problem. In this unjust social structure, there must be a systemic, fundamental reform. So the government must get rid of this welfare mentality. The government must try to protect basic living rights of people. Just now, deputations expressed a lot about situation or difficulty faced by grassroots workers. Now, these workers are facing employment problems. Under the original social welfare concept, if people can improve their livelihood, on the first tier, there's not the need of a lot of social welfare. But even though we have minimum wages today, many grassroots working households are poor. Besides, their elderly parents also face problems they face problems about caring for their elderly parents. And the problem will be even more serious if some family members are chronically ill or disabled. Now, the problems have to be taken up by the families themselves, and in the overall social welfare system, everything is being placed on the shoulders of the families. We will intervene only if they fail to do so. Hong Kong is a rich society. It is not possible to say that the government cannot take up more. The government should set up a universal retirement protection scheme. Our population is aging. If the government does not implement the scheme as soon as possible, the pressure on the next generation will be bigger. So in the welfare planning, the threat of aging population and the wealth gap problem must be incorporated into your planning as objectives. You should make an undertaking to the public about roadmap and timetable of universal retirement protection. Thank you. Next, Mr. Simon Tam, New Territories Evangelical Ambassador. Thank you. On the 1st of April, $2,200 will be given to the elderly, but this allowance cannot solve problems for the elderly. Elderly poverty problem has not been alleviated. In Hong Kong, the elders don't have MPF. They rely on OAA for their livelihood. Medical expenses are on the rise, and every year there is rising inflation. The elders are living in poverty. For the housewives, they contribute their lives to their families and their children. They do not take up employment, so they cannot enjoy MPF. They can only rely on their children to support them. But their children's salaries can only take care of themselves. So that elderly allowance can only serve as a platform. We think that the Poverty Commission should open a file to establish universal retirement protection so that the elders will have hospitalization and healthcare services eligibility. And the Poverty Commission has already formed a consensus on poverty line at 50% of median household wages. The government's proposal is that they have to also calculate after tax, after welfare transfer poverty line. So in other words, all education, medical expenses will have to be counted in as cash. So we have a lot of reservations about that in this kind of calculating the poverty line. If this method is adopted, there are not many poor people in Hong Kong. According to the Hong Kong CSS report, in Hong Kong, there are 1.1 million poor people. If this new poverty line is put in place, then there are only 600,000 to 700,000 poor people, a big difference. The government proposed that there should not be more than 1 million poor people in Hong Kong, then many poor people in Hong Kong will become invisible. The government only adopts some measures to reduce the number of poor. I think poverty alleviation effort is not strong enough. So we will surely be against this definition of poverty line because many people will be out of the net. The government should not be doing that. Even if housing benefits or housing welfare is calculated, we have to look at like 30 to 40% of household salary to work out the housing, education, and medical welfare. But then medical welfare is the right of citizens. Do you want to be like UFA or Qinghui in history? It's up to you to decide. Thank you. Next, Mr. Chow King, Smart and Beauty House. Chairman members, in Hong Kong, for disabled children 3 to 4 years old, they don't get enough support, and there are not enough support centers. They cannot make inquiries, and there is a lack of publicity. When hospitals assess the children, they they have taken too much time. It takes 1 to 2 years to see the doctors. And so the golden opportunity to help them improve will be missed. For special schools, there is not enough support and care. Concerning the language training, there is not enough support because there are not enough social workers. So there are only non-regular therapy sessions, and then there is a lack of local support workers. The government pushed forth the ability assessment mechanism. This is not fair to a lot of people. In relation to employment, I think that there should be same pay for same work, equal pay, equal work system, and that should be the minimum wage legislation. I think some people are employed at wages lower than market wage, and the government is turning a blind eye. In relation to employment allowance or seed fund, the seed fund is being changed into a long-term policy. Very often, employers breach the law, and they're not paying minimum wages to the handicapped people or the mildly handicapped people. For these people, they don't enjoy quarters or accommodation allowance, and there is no employment referral service for them. I think employment referral should be on a long-term basis, and there should be seed funds, and there should be a rule on the proportion of disabled being employed. The government should take the lead to set this limit, and in fact this proportion or this ratio should be written in the law. There must be more care homes. The old ones should be redeveloped because they are outdated. Now 8,000 odd people are waiting for places. They have to wait for at least 10 years. Finally, we would like to ask for universal retirement protection scheme. Many disabled people are out of jobs, and they won't be able to contribute to MPF, and there is no universal retirement protection. So what can they do after they retire? The wealthy people don't need to worry, but then for the poor, they may have to weep. Okay, thank you. Next, Ms. Vanny Kwok, North District Employment Concern Group. I represent the North District workers. I want to talk about Leung Chun-ying's policy address. During election, Leung Chun-ying said that when he was young, he was a grassrooter. But we're disappointed because in his policy address, he didn't say anything about long-term social welfare planning. We're disappointed because he has a grassroots background, but he does not show concern to us. He is putting pressure on us. That's one point. Secondly, even if wages go up to $30, we cannot catch or beat inflation. So minimum wages should be $35 so that workers don't need to face such a big plight. Next, about universal retirement protection. We are middle-aged women. We have been homemakers for a decade, and we cannot take up employment now. We don't have savings. We don't enjoy MPF. We can only rely on CSSA, but we don't want to do that. So, Secretary, I hope you can consider universal retirement protection. Our workers have some views about retraining. We have to pay for retraining, but if our attendance rate is not enough, we will be penalized. We are not primary students. We have to be penalized. We have to be fined. when our attendance rate is not high enough. What's the reason for that? Next, have you been to Shangshui and Fanling? Many village houses have been divided into a few houses, but then for these separate houses, they are not entitled to the We Care Fund. So I think you have turned a blind eye to the number of people who are not getting the allowance, and you only pay $2,200 to the elders. Well, Confucius has passed away. If he is still here, he will be suffering from hunger with only $2,200. About school children, there's only $3,000 for them. Well, they cannot even go out. They have not enough food to eat. You are talking about education tours. Not all schools arrange education tours. What are you doing? The community care fund is useless. And then the $2,200 allowance is also useless. Mr. Leung Chun-ying's mother, Mr. Leung Chun-ying emphasized a lot that his mother made plastic flowers to feed him. But now we cannot take up this kind of work. So, okay, your point is very clear. My last point for the government. I think we should be worried about inequality, and poverty alleviation policy must be something serious. Thank you.
Next is Catholic Diocese of Hong Kong Diocesan Pastoral Center for Workers, New Territories, Ms. Vivian Yao. Thank you. We urge that the government will immediately set up the Universal Retirement Protection Scheme. Now, a lot of friends here today have expressed a very clear opinion to the government that the government must do this immediately. Now, the current MPF system does not protect a lot of people, such as people with very low wages. That is, the MPF is not be enough to secure their future. Furthermore, for people who are already retired or people who are about to retire, they haven't been contributing to the MPF for long enough, so there is not enough security. Furthermore, in terms of women who stay at home, there are a lot of them in Hong Kong. When they actually retire, so they must rely on their children only, or they really don't have any security. So the government may say that, yes, the MPF has problems, so we have the CSSA to support, but that also has a lot of problems. First, using family as a unit for calculating the income. In fact, many sons and daughters cannot support their parents. So the government is giving the responsibility to care for retired people and giving the children, and that is irresponsible. Furthermore, in terms of calculating the income and in terms of setting a restriction, a lot of elderly people don't want to have the government looking into their assets, and a lot of children and also do not want that. So also this discourages saving, because if you have a lot of savings, then you don't have CSSA. The biggest problem is that CSSA is not very effective. And now this is caused by the SWD and the LWB. Now a lot of old people have to pick up cardboard and get an income of around $5,000 each month. They would rather do this than to get CSSA, because they think it's very shameful to receive CSSA. In fact, the SWD every now and then publicize such cases where people are abusing CSSA, and they strongly criticize it. So a lot of elderly people thus do not want to receive CSSA because it feels that CSSA is a shameful act. Furthermore, a lot of people oppose universal retirements because they say it's unsustainable. Actually, look, the current CSSA system it's indeed not sustainable, because it's only spending the government's recurrent expenditure. So lastly, we support a universal retirement protection schemes. Thank you. Next is Mr. Wang Yat-hing. Mr. Wang Yat-hing. Thank you, Chairman. First, I want to say, in terms of long-term planning, I think actually the government has long-term been depriving citizens of long-term planning. Actually, I am a student of social welfare, and I see that a lot of planning in terms of social welfare, the planning is lacking in social welfare. So I'm looking into the support for young children. And someone see that a lot of government programs is not sufficient, such as not enough spaces for young children. For each of these, so there are only 720 spots for 18 districts. The government is saying that that's sufficient as long as NGOs has this space. So we're talking about 40 spaces for each district. Would 40 be enough for each district? Further, the service fees is very expensive. Now the daycare center is $18 for each hour. So if we do this, the calculations, then we can see that for a month, it's more than $3,000. So for a grassroots person, then they cannot pay such fees. Further, we keep on saying that daycare services and those service providers are volunteers, but that's incorrect. You say that they are volunteers, but in terms of the government, but they only receive $20 per hour. That is really not adequate for them. And the carers can only take care of 3 children. Now, sometimes they must give their own fee if they want to buy lunch. So a lot of times, actually, they are losing money. So a lot of people will not become a daycare provider. I asked these daycare service providers how many people are taking care of children, and a lot of time I don't get an answer. So I really I'm concerned about whether there are enough carers. So a lot of times they're in a very inconvenient locations. For example, they have to take transportation for half an hour. So in fact, it's quite useless. Further, we hope the government can increase the daycare center spaces and to let it become an actual occupation. So they should be protected by the minimum wage. Lastly, we think that there should be a universal retirement protection scheme. Thank you. Next is Mr. Wang Yuncheng. Hello, everyone. In terms of the long-term planning documents, I have 3 of the following opinions. First, a lot of the measures mentioned are short-term. So we think that the government should set some long-term welfare planning. Now, in terms of long-term, it must be counted in terms of 5 years or even 10 years. Now, also, this long-term planning should be reviewed every year to support to allow for changes in the society. Further, the government should also have some preventive measures instead of solving problems when they actually occur. This will only cause the greater dispute in the society and cause labeling as well as worsening the wealth gap. Lastly, in terms of universal retirement protection scheme, we have some opinions. As a student of the social sciences, in the first class that we went to, the first thing we learned is that welfare belongs to all Hong Kong citizens. Why is it that a lot of Hong Kong elderly people are living below the poverty line, and Hong Kong government will only launch measures that shirk responsibility, such as the OALA? We think that each elderly person should have a life with dignity, and their living should be protected in multiple ways. So I hope that there will be a universal retirement protection scheme so that all of the elderly people can live securely. in their old age. Next is Mr. Lam Yuk-chan. Thank you, Chairman. Hello, everyone. I am a student of the Baptist University. I want to talk about the Universal Retirement Protection Scheme. Now, Hong Kong is a developed place in the world, but we do have a lot of people with low wages. Now, this year's social welfare expenditure is only less than 10%, and now people who have low wages are not adequately protected by the government. Now, these people do not have a lot of income, but the housing in Hong Kong is so expensive. So after these people pay the rent, they can't save a lot of money. So after they retire, they have a lot fewer retirement funds compared with other people with higher incomes. So whatever measures the government have really cannot let them have an adequate living. So, in fact, they may have to apply for CSSA just to maintain basic living. So now there is the MPF. Now, even though it's been launched for so long, a lot of people say that MPF does not really help matters much. MPF is really just letting people take care of their own poverty problems. Now, the MPF's protection is very narrow. In the past few years, a lot more people are concerned about Universal Retirement Protection Scheme. Now, the administration has launched the OALA in response to these concerns. Those elderly people above 65 years old can apply for this, but they must undergo an assets evaluation, and the money that they give, that is 2,200, is really not adequate, and the assets evaluation is very inconvenient and may cause embarrassment to applicants. Now, the elderly people have made a lot of contribution to Hong Kong society. Is it just we ignore them after they're no longer working, so let them live in the subdivided flats and eat poor quality food? So I think that in order to protect their living quality and to respect their dignity, I urge the government will have universal retirement protection scheme as soon as possible. Thank you. Okay, thank you. Next is Mr. Cham Kam Yuen. Thank you. Now, in terms of disabled people, there were not a lot of mentions in policy address. Actually, there were a lot of mentions, so we welcome this. So I think that the government should have a long-term planning for this, and should have a white paper for this. Now, so that us social welfare organizations can do effective work, such as the current disability policies has not adequately changed to reflect changes in society. For example, some assessment criteria has caused inconvenience to some people, and also some disabled people under some assessment criteria cannot have their concessions for transportation, and so this has caused them inconvenience. So we should have more concession for transportation, so that the disabled people can have more convenient transportation. So I think besides medical care, the SWD should also have increased the manpower in terms of assessing the situations of the applicants. At the same time, we should have a consultation with the public and listen to the disabled people's needs. Thank you. Thank you. Ms. Chung Alai. Yes, thank you, Chairman. Today, I want to talk about women's employment. Right now, Hong Kong society has faced a lot of inflation, and a lot of grassroots families are facing difficulties. They must only save money, such as in living and in eating. Now, women have a lot of pressure, especially those in the grassroots. So perhaps the husband's income cannot sustain the family. So a lot of times, these women have to find jobs as well. So the society has not provided a lot of support in terms of this. A lot of women, in terms of employment, they face a lot of difficulties. They feel helpless because they're going out to find work, but then they have to place a family. They have to leave their children behind. But has the society provided enough daycare service? So there are not enough daycare spaces in each district. Further, if women from grassroots, what kind of jobs are they doing? Why is it that a lot of times the daycare services do not happen during holidays? So is it that during holidays the woman cannot work? They must have to get a holiday permission from their boss to take care of their children. Furthermore, a grassroots woman face a lot of financial difficulties. If the daycare services are so expensive, how can these women who are getting $28 a day an hour can pay for these services? So in the end, it may not make it much sense for them to come out and work because the financial implications will not change. Furthermore, so the system that you set. So what kind of families do you think can accept these daycare services? A lot of women who do not qualify under your framework, then they cannot enjoy these daycare services. They have to stay at home and take care of their children. So perhaps if the children become teenagers and so the woman can want to start working again, then it will be very difficult for them. Then if they can't work, then they will not be financially independent. And who will take care of them? What if the husbands don't give money to them? Then who will protect their livelihood after retirement? So a lot of people, everyone here has been taking care of our parents, especially our mothers. Now, if these women have we given them adequate protection in their old age? So why do we give them so many obstacles in terms of inadequate daycare centers? So how can they be financially independent? Thank you. Next is Mr. Yuen-han. Thank you, Chairman. I am a student of Hong Kong Baptist University. Today, I want to talk about the Universal Retirement Protection Scheme. Now, Hong Kong is seeing a lot of aging population, and the elderly poverty situation is worsening. Now, it's saying that the three main pillars, that is MPF, personal savings, as well as other welfare measures. These are not enough. The elderly people have contributed to the society for most of their lives. And the government has the responsibility to protect their basic livelihood as well as their dignity. And a lot of people feel that there's no security for after their retirement, and they feel very worried. The polls show that they want to have a universal protection scheme as soon as possible. A lot of other countries have a public retirement scheme. Hong Kong is an international society and should go along with the times and protect the citizens' livelihood. Some people say that the fruit money, as well as the OALA, can help alleviate poverty, but in fact, fruit money cannot protect the livelihood of all elderly people, such as women who don't work, or people who do not have an MPF account, or people who are sick. They cannot benefit, and a lot of times because these people have low income and they don't have extra money to pay to the MPF, to contribute to the MPF. Furthermore, some people say that the universal scheme would have a lot of money and the government would have to subsidize this 700 or so billion money for the next 45 years. But in fact, if we look at the current fruit money, etc., that's already being undertaken, it seems that actually it would only cost government an extra $3 or $4 billion to set up a universal scheme. So, and that is, the government has the ability to support the universal retirement protection scheme, and also because this will be managed by the government, the people will not have to be afraid that MPF companies will have such high administration fees, and so this will also protect people who do not benefit from the MPF. Universal retirement protection can redistribute the wealth and to help alleviate the wealth gap in Hong Kong. In 2005, this was discussed, and there was a consensus in society. So the administration should not delay and should implement the consultation Hong Kong-wide as soon as possible. Thank you. This is Mr. Chang Pat-ron. Thank you, Chairman. Hello, everyone. Hi, I'm a student of Hong Kong Baptist University. Yes, may I continue? Yes, there's no problem. Now, today I want to talk about Universal Retirement Protection Scheme. So, before I really know what the scheme is.
I thought Hong Kong was a perfect city. I did not have to worry about my future. That's for the future. However, when I started my internship, when I started to understand the grassroots issues, I discovered that reality was very much different. For OAA, $2,200 is definitely not enough for the elders to meet their needs. What can you do with $2,000? Eating? Well, after paying all the miscellaneous expenses, you no longer have money to save up for the future. As for MPF, there are two fundamental problems. People's wages are already very low. What they save up cannot meet their needs in future. Besides, some joined the MPF scheme only after the scheme was implemented. So there's not enough time for them to save enough money for the future. And then for statutory minimum wage, we have such a high inflation rate, the SMW won't be able to sustain a living. And then for universal retirement protection, after meeting with the grassroots, I discovered that there are more problems than I thought. The government must face this squarely. The government must face this very squarely. Mr. Chiu Si-kan. Mr. Chiu Si-poon. Well, I, Chiu Si-poon, have been working since 1946. I've worked for 67 years. I paid tax till the year 2000. I'm 70 years old then, and then I served as a volunteer for 13 years now. I'm involved in 2 organizations for a decade. For Universal Retirement Protection League, in 2003, it was established in Trader Garden by Dr. Fernando Zheng. The sun was fierce on that day. I was a founding member. As for the Monitoring League, we saw that the initiatives launched by the administration, like medical financing, aging in place, etc., are all empty words. The government does not want to pay more. So what can you do? I think the best is the League for Universal Retirement Protection, which can take care of everybody, not just the elders, the women, the disabled, can all be taken care of. The government is afraid that it will have to take on this so-called burden. The MPF is not enough. only 180,000 people are receiving CSSA. Mr. Matthew Cheung, the secretary, mentioned OAA at $2,200. He mentioned 400,000 people benefiting, which doesn't matter. Even if it is 500,000, 600,000, or even a million, history tells us that we'll be able to sustain them. For 5 million working people, 6 times 5 only costs you $3 billion in total. Taxpayers $3 billion, and the government has a huge surplus. Even if it is $10 billion, it doesn't matter. The data tell it all. For 10 years, I did all the calculations. We have enough to sustain them. It doesn't work to just have makeshift measures. Well, the government has a reserve standing at $2 to $3 trillion, and that will not be used at all. So we have enough. We have an adequate reserve. I think the government is proposing something that is laughable, is impossible. Thank you. Next, Mr. Lam Chi Chong from Elderly Council of Chun Kwai Tsing District. Madam Chairman, we are concerned that the government must meet the request of the non-government organizations. We must have universal retirement protection. I suggest the LegCo erect a countdown display board. Start with 1,000 days. Within 1,000 days, the administration should proceed with or implement universal retirement protection. So I request the LegCo do this. Some elders told me that they're chronically ill. Every month, for medical expenses and medication, they have a heavy burden. So what do they request? They request that the SWD and Mr. Matthew Cheung, the secretary, abolish the medical expenses for the chronically ill. Elders do not have earnings. When a person becomes old, is bound to have more diseases. So I think the government should take care of the medical expenses and medication expenses of the elders. Within the next 2 years, the elders should be exempted from medical expenses such that elderly health can be protected. Thirdly, ordinary people may not really need CSSA. They want to rely on themselves. I heard that in Mongkok, we can set up a hawker permitted place, like that in Tung Choi Street. Now we have over 10 district councils. At suitable venues, we should set up a free trade venue. Hawkers places and traders places. We must change our concepts about hawkers. Hawker control teams should be converted into hawker assistance teams so that they can assist hawkers and traders to improve their livelihood and to reduce their reliability on the government and to reduce the number of CSSA recipients. Well, these are fundamental solutions. Hong Kong is a free society. Under free economy, big consortia have freedom, but ordinary members of the public don't have any economic freedom. Next, Hong Kong Chinese Civil Servants Association, Social Security Assistance Branch, Mr. Chan Chan-wang. Thank you, Madam Chairman. The Social Security Assistance Branch is under the HKCCSA. Over 70% of our members are civil servants. social welfare is an important part of government. I would like to share with you my views about social security, which is very significant in protecting the livelihood of the public. Members of the public should have fundamental rights to live. Wealth should be transferred from wealthy people to poor people, from healthy people to weak people, from young people to the elderly persons. Then we can create a fairer society. Payers for Social Security are taxpayers. The beneficiaries are the poor people. And politicians stand to benefit politically. So whether or not you're in politics, you're concerned about Social Security. So we should strive for support from all sectors of the community, in particular when election comes. We must guard against the abuse of Social Security as a tool for canvassing votes. Now Social Security becomes a tool for politicians who launch immature plans and schemes that have not yet got consensus. And civil servants are caught in a dilemma. Civil servants are the executives. So sufficient manpower support should be provided to the executive. Otherwise, without enough civil servants, we cannot effectively implement policies and initiatives. Hong Kong is a highly developed society. For GDP per capita, when compared with other developed jurisdictions, there's still plenty of room for improvement. As civil servants, we have to discharge our duties. We are being paid, and same as you, were born and raised here. We ourselves, our parents, siblings, friends, and schoolmates should enjoy social welfare that's commensurate with social advancement. So corresponding support should be given to civil servants so that we can do better. Most Social Security schemes are implemented by our colleagues. The public may feel that we are biased in implementation. So what we want to say is we do have difficulties in implementing Social Security. Thank you. Next, queer citizen, Billy.
With an aim to monitor and advocate on LGBT issues, policies, and promote LGBT equality in Hong Kong. The Domestic and Cohabitation Relationship Violence Ordinance came into force in January 2010, extending the protection under the ordinance to cover same-sex cohabitants. According to the Secretary for Labor and Welfare, only 5 newly reported cases involving violence among same-sex cohabitants between January 2010 and March 2012 were captured by the administration. 5 cases in all of the 26 months after the ordinance came into full force, Mr. Secretary. In contrast, 6,900 cases were recorded among those of opposite-sex cohabitants and spouses during the same period. The percentage of these cases involving violence among same-sex cohabitants made up of less than 0.1% of all the cases reported. Based on the estimated figures where gay, lesbian, bisexual, and transgender individuals, or LGBT individuals, make up about 5 to 7% in every general population. This figure is severely and disproportionately low. As such, the protection offered by the law is virtually useless. A 2009 study carried out by the Chinese University of Hong Kong found that over half of the same-sex cohabitants had said that they have been subject to physical assault, physical violence, and even sexual abuse. The severely and disproportionately low figures captured by the administration indicated that many victims are still afraid to seek assistance. The studies also indicate that less than 10% of the respondents would bring up such matter with social workers, psychologists, and counselors. Even fewer would turn to social welfare departments, the police, or non-governmental organizations for assistance. Some of the reasons include: 1, the perception of the lack of organizations or government agencies in Hong Kong dealing with violence among same-sex cohabitants. 2, not knowing where to turn to in order to obtain adequate support and assistance. And 3, fear that the organizations or government agencies approached may not be adequately trained in dealing with their problems or situations. There ought to be direct and specific public education campaigns to adequately and effectively address the situation, and sensitively training in order for frontline workers to offer assistance and support to these victims. The service so far provided by the SWD is none other than distributing printed materials with limited outlets or through their websites, glossing over that victims who are subject to domestic violence can still receive service regardless of gender, race, or sexual orientation. The method employed by the SWD is not one that's user-orientated, which in turn results in severely and disproportionately low figures for those who seek assistance, who need assistance. Respectfully ask this panel to urge the administration to 1, review the effectiveness of the ordinance since the amendment came into force, and 2, carry out campaigns that target the LGBT community in specialized and focused manners, for example, working with grassroots community actors, including allocating funds and resources to organizations that carried out such work. Thank you.
Thank you. 跟住呢，荃灣長者聯合
Thank you. Next, Yuen-han Elderly Joint Group, Ms. Lee Mei Ying. Madam Chairman, members, good afternoon. I am the representative of Yuen-han Elderly Joint Group. I'm attending this public hearing to represent the elders of Yuen-han District to air their views on the problems of social welfare policies, which are inadequate at the moment. Let me first mention something about dental services. At present, government dental services are inadequate. Time slots are too few. Every week there are 2 days of service, Tuesday and afternoon, only in the morning. And only 84 chips are distributed. And elders have to queue up for chips in the early hours of the day. And then after tooth extraction, they don't follow up with the necessary denture services. And also, services vary in quality. There were 2 occurrences in which the roots of the teeth were not extracted. And on one occasion, only one side of the root, or the root on one side of the tooth, was extracted. So I hope that there can be at least one dental clinic in each of the 18 districts. And comprehensive services should be provided to the public. That is, we must have a so-called through-train service. When we met with C.Y. Leung, when he prepared his manifesto, we mentioned healthcare vouchers. We said that healthcare vouchers could not quite help us. Be it $2,000 or $3,000, the vouchers could only subsidize private hospitals. I hope that the government can set up more public dental clinics. And for those queuing up for outpatient services, it's very difficult to make a booking. So elderly clinics should be set up. There should be more people to take our telephone calls. Our eyes and ears are not good. The recording asks us to press this button and that button. Is very difficult for us to hear all those instructions. Yes, thank you. Your views are heard. Next, the group of youth welfare policy concerns, Mr. Chang Wai-him. Good afternoon. I'm Chang Wai-him, registered social worker. I don't know why I'm given the serial number of 64. Social welfare planning is a political issue, and June 4th incident is a tragic and cold-blooded political incident. All right, let me come back to this issue. The group of youth welfare policy concerns would like to put forth the following points. First of all, the government must have thorough thinking about policies and initiatives. We oppose the seeding fund. Secondly, we must have medium and long-term planning every 5 years and 10 years respectively. And we must attach importance to quality as well as quantity. And then tripartite universal retirement protection should be adopted as soon as possible. Fourthly, welfare planning must be democratic with a great deal of participation on the part of the public. In my submission, I mentioned co-responsibility. Co-responsibility is just like what the HA Housing Authority is doing. Professionals, various stakeholders, government, etc. should form a body with co-responsibilities, and maybe the members should be elected. You should refer to my report for the details. Why should we oppose the seeding fund? CIF is always mentioned by the government.
It is the way the government encourages the business sector and the community to build a network. But when enterprises are incorporated into social welfare sector, the enterprises are conglomerates. They do not have any moral obligations. So this is an illogical concept. The only consequence is collusion between the government and the business. And members of the public are forced to cooperate. The government sets up this kind of seed funds. I think this is an all-evil new liberalism. As a result, different enterprises try to express that they are moral. At the same time, they are using this as a means to advertise that they are moral to profiteer. And I think we cannot find this acceptable. I think it's almost time. Overall speaking, we need welfare planning, democratization, and long-term welfare planning. These are things that we are striving for. Thank you. Next. 青年貧窮陣線 Mr. 潘惠倫. We have been striving for universal retirement protection for 30-odd years. All along, the government has not been providing a comprehensive retirement system for the elders. They have diverted our attention to different types of subsidies, allowance, and favors. And there will be means tests. The elders have to comply with all the documentation requirements. They are also often worried that they may have overlooked some items that they need to declare and that they will have to face criminal consequences. Students also have to face means tests. We understand that means tests have often been like a deterrent to the needy, and these people cannot get help. In Hong Kong, there are 160,000 elders who are eligible for CSSA, but they don't want to be deprived of their dignity, so they choose to pick up waste cardboards, and they choose to sleep on the streets. Is it true that they haven't contributed to society, or they have been lazy when they're young? No, they have made a lot of contribution. The chair that you are now sitting on, Secretary, may be made by them. Without them, we may be sitting on the floor today. They do not have any labor protection, and they have been exploited by the enterprises during the British colonial time. They have helped industrial development in Hong Kong, but when they become old, they have lost their jobs. When they wanted to become cleaning workers, but then the government has outsourced or contracted out public services. As a result, they are now being exploited by Li Ka-shing and Li Xiu-kei. They don't have any protection for their life after retirement. Leung Chun-ying said that the elders have to plan for their life after retirement. I think this is really immoral. I don't know why he always refers to Mrs. Leung, old Mrs. Leung. We always propose a 50 billion fund and Li Ka-shing tax, and then there should be universal retirement protection so that elderly will enjoy $3,000 retirement benefits. There won't be a labeling effect, and we can also pay back to the elders. We thought that you had now listened to people's views, but he only offers $2,200 to the elders. He's saying that even pocket money from their children will form their assets. Now, are we trying to protect tycoons like Li Ka-shing? Since the profits tax rate is only set at 16.5%, university graduates and members of the public have suffered enough. We have tolerated enough of your advertising and your bullying the elders. Are you treating the elders as beggars? We want universal retirement protection. Please do it right away. Thank you. Next, 青年撐退保聯盟 Ms. Ho Kit Ming. My name is Ho Kit Ming. On the 7th of December 2012, the government used different tactics to make sure that the elderly allowance has been passed. And then in 1967, there was already discussion about universal retirement protection scheme. And then the past governments have been passing the balls to the next government. And finally, they have resorted to such an insulting move. The 3 pillars are ineffective. There is 1 out of every 3 elders who is living below the poverty line. The elders pick up waste cardboards for a living, and they want to save electricity, so they do not turn on lights or television. Do we want our elders to live like that? The first pillar, $1,090 OAA, $2,090 standard CSSA payment. Is that enough for buying food or covering traveling expenses? We have high inflation. How can we make sure the elders can live with dignity? The asset upper limit is 38,000, and at Beaufort-San, even the lowest earn space costs to 20,000. So I think this kind of pillar is ineffective. The second pillar is MPF scheme. We have 700,000 home makers and 200,000 unemployed. They are not covered. The coverage rate is only 60%. Low-income earners only contribute a small amount. How can they have a decent life after retirement? The housewives have not worked in the labor market, and then for the grassroots, they earn low wage. University graduates have to pay back 200,000 loan. We are only giving our money to the big conglomerates and consortia. Under the neoliberalism, the government's role is only very limited. They have shirked the responsibilities to individuals, families, and other units. As a result, the elders cannot live with dignity after they retire. They are being bullied and despised of. For the senior government officials, after they retire, they can live in a luxurious way. But do you still remember that outside there are scavengers and there are elders who are living in a very meager way? The government wants to improve people's livelihood. I cannot really see any move that can match this objective. Can you please be really people-oriented? Can you really do something for the elders and Hong Kong people? Thank you. Next, Social Science Departmental Association of Caritas Institutes of Higher Education. Mr. Fu Wai-han, External Vice President. Thank you, Chairman. Since the year 2000, SWD changed the subvention system from a fully recoverable basis to lump sum grants. In the past decade, we have seen so many problems of the system. For a co-worker, even before he joins the sector, his wage is pressed to a low level because resources have to be spent on providing more services. And every year, a new contract is signed. There is no way to give him a peace of mind. Even the experienced people are not better off. When their salary is being adjusted, they will be worried that they may be laid off because they are earning high income, because the organizations want to retain more money within the organizations. So the senior experienced workers cannot pass down their very valuable experience. This is a big obstacle in the development of the social welfare sector. In 2007, the government set up the PW or established the PW position, saying that young people will have good opportunity to develop their career. And this is a way to lower youth unemployment rates. At the same time, they have brought about positive impact to the sector. They are good human resources. They have perfected the organization's service. They've also developed other new services. So, to be brief, their services have benefited many members of the public. Besides, for the PW position, it gives good opportunity for different people, especially students, to get to know more about the social welfare sector. Taking our school as an example, many students have taken up this position of PW. So, Secretary, please do not deny the contribution made by these PWs. I think this position should be formalized. And please rectify all the problems about the lump sum grant. Secretary, I hope that you will no longer be receiving salary. Please really work for people. Your strategies, your policies, your objectives should be such that you are serving Hong Kong people. Thank you. Next, Mr. Wong Tan-ching from 明愛專上學院關社組. Yes, I am Mr. Wong, not Ms. Wong. We're talking about mid to long-term social welfare planning. Today, many deputations have asked for universal retirement, protection, and new liberalism. What is new liberalism? Now we always hear positive non-intervention, free market, and making sure means can make ends meet. So, in other words, we are only treating the symptoms in social welfare. All these points have been made many times. Secretary, have you thought about this very carefully? When it comes to, for example, transportation subsidies, you are helping the employers so that they don't need to offer high salary to attract people from other districts. For rental allowance, you give only 1,400 per person. Can you ask Mr. Chen Ma-po how much is a compartment in or a cubicle in a compartmentalized unit is? And you are paying money to do means tests, and you are giving out all the administrative expenses, but you don't want to offer universal retirement protection. Are you worried that the MPFA people will be out of job? I think you said that you want to help the market. Are you really helping the Hong Kong economy, or should you be helping the Hong Kong public? Who is more important? You are government officials for the people. So I think my previous descriptions about the government are all valid. I think the core is that your welfare mentality should be changed. You should not adopt a curing approach. You should be adopting a preventive approach. That's all. Thank you. Sorry, I haven't finished. Tax reform and changing the financial management mentality seems to be simple. But why can't you do it? Because your government doesn't have the mandate from the people. You only have 689 votes. Not even your big brother has a lot of votes. People's opinion cannot be brought up to LegCo. Half of LegCo members are elected from functional constituencies. Only with dual universal suffrage can we make sure that our voices are heard in LegCo, and then LegCo members will consider our proposals, and then only then will members of the public be able to enjoy the welfare. Thank you. Next, Hong Kong Federation of Handicapped Youth, Mr. Leung Wai-kin, Policy Advocacy Officer. Thank you. We are a self-help organization serving the handicapped. First of all, we want to talk about the medium to long-term social welfare planning. Recently, social welfare policies are fragmented. You only try to treat the symptoms. Things are on a piecemeal basis. When there is one policy, and if there is any inadequacy, you will try to rectify it. The last government wanted to adjust the OAA, and then a lot of work has been done. This time, another type of allowance is offered to the elderly. So things seem to be very short-sighted. You have not been very detail-minded in your consideration. Now many handicapped people or disabled people are out of job. If they can find jobs, they don't want to be on CSSA. Now there is employment subsidy and a lot of things as claimed by the government, but still employment rate among the disabled is low. We want long-term plan from the government to help the disabled to seek jobs. If they can seek jobs, then there is no need for them to rely on government's allowance. And about the disability allowance, it cannot be paid together with OAA. On SWD's website, it is claimed that the disability allowance is for the disabled to meet additional expenses because of their disabilities. Why can't the two allowances be paid together? Since the government also acknowledges that disability may lead to additional expenses, but then the elders can only choose one out of two. Elders are entitled to OAA, but since they are subject to additional expenses, why are they asked to choose one out of the two? In fact, you are not really giving extra benefits to them. They do need the money. So I hope the arrangement can be amended. And then about the disability allowance, over the years there has not been any large-scale review. In 2009, the Ombudsman asked the government to change it. But so far, no progress has been made. Some time ago, an interdepartmental working group was set up, and yesterday, the secretary said that not even the first meeting was held. So this should be reviewed as soon as possible. As a self-help organization, now the government does not give a lot of support to self-help organizations. We have put in a lot of effort to raise funds to maintain our operation. And as a result, our support and service for the disabled will be affected. We hope to get more support from the government so that we can concentrate more to serve the disabled. Next, Ms. Chu Tin Lok, Social Affairs Committee of the Hong Kong Federation of Trade Unions. Many years ago, the FTU already submitted some proposals that are feasible, but so far, Hong Kong lacks a planning blueprint which is forward-looking. There is the working poor, elderly poverty, intergenerational poverty, and so on. We believe that employment support will be the best way to alleviate poverty, and there should be an employment-friendly environment. We think that there should be priority given to employment so that there will be social mobility and pluralistic economy. There should be active reallocation of resources to subsidize employment. The vulnerable groups can also improve their living if they can get jobs. Well, work is not only a means of livelihood, it is also a reflection of people's dignity. Many Hong Kong people want jobs instead of getting favors from anybody else. They want to be self-reliant. Only in that way can we have a pluralistic and inclusive society. We are talking about long-term planning, not piecemeal fragmented measures. In face of an aging population, there should be integrated retirement protection scheme so that all members of the public can benefit. We don't need to worry that we won't have income after retirement. In 10 years' time, and there is an increase of 48% of families not taking up economic activities. Half of them are over 65 years old. They have retired. Their median wage is $4,320, which is not enough to meet basic living expenses. Now, the retired elders are in difficult times, and in 2041, elderly people will account for 30% instead of 13% now. And what will be people's livelihood like? Poverty problem in Hong Kong has to do with transformation of our economy. We cannot shirk the responsibility to individuals. In the future, poverty line will be drawn. I hope that two principles will be incorporated. First, there should be the concept of absolute poverty to draw this basic living protection line, and then there should be a relative poverty line so as to understand the cause of poverty from various angles. In this way, we will be able to eliminate poverty. Next, I think we have to make sure that social services are people-oriented, and so other provinces apart from Guangdong should be covered, and all welfare services should be portable. Administrative procedures should be simplified so that retirees on the mainland can receive the benefits. And when about the tax system, it should be refined. We think that there should be progressive profits tax so that there will be a fair arrangement. Those who earn more will be paying more tax. And then we propose capital gains tax so that there will be more usable resources. Thank you.
Thank you, Mr. Leung Shek Lun, Hong Kong Federation of Women's Centers. Thank you. First, we want to say that we are very disappointed that Xi has again lied to the citizens, because when he was campaigning, he said that there will be a medium and long-term planning for social welfare and a clear objective. But in the policy address, he really did not talk about this. He only talked about that was already been discussed in Donald Tsang, and that is that it should be flexible and practicable to respond to the public. So we're very disappointed. And we also feel that the overall planning for social welfare only has a lot of consultation, but there are never objectives. And the consultation are often not even true. A few years ago, there was a consultation with a lot of group members, but these group members did not agree with a lot of proposals. But even the proposals were eventually put in the reports. And a lot of times, even though a lot of organizations support a universal retirement protection scheme, but there is no consensus in the government. So we don't really see how the government handles these consultations. Also, I don't think there is direction and guideline. So now let's say you're talking about daycare center. 2 years ago, the government increased 700 or so, 720 daycare spots. So what are you hoping to solve? What is your ultimate aim of increasing these spots? If you want to solve the problem of women being employed, so after the 720 spots have increased, so how many women are still unable to work because they have to take care of their children? What are the figures for that? Or how many women do you want to see working? So from data in 2010, we can see that 48% compared to a lot of other countries is lower, such as Japan is 62. So without these data and without these guiding data, how can we monitor the governments? How can we cooperate with the governments to think about how to improve the situation of women employment? Furthermore, I don't see that there's there's no gender discussion, because the C, in talking about with the Women's Commission, it says that we see that women's position has increased because we see that a lot of executives and managers, in terms of we see more women in those positions. But we see that even though we increase the status position, does not mean that a lot of the women's overall social status has improved. Is that in terms of the international conventions, in terms of we also must look at cultural and daycare and other factors. So we don't see this in terms of social welfare. So hope that the government will add its strength in terms of the daycare facilities. Thank you. All friends, members and deputations and officials. So right now we still haven't started with members' questions and officials' response. Now it's 1:45. Now this is actually exceeding our time. So I have discussed with Deputy Chairman. So there are 70 or so deputations, and there are a lot of different opinions, and many of them, or I should say some of them are varied. So if we increase the time, let's say if we do, even if we increase the time, that there will not be enough time to discuss. So I think we should have a special meeting. So we should, besides, we should have ask the Secretariat to have a special meeting before a regular meeting. So we'll have 2 hours to discuss these issues. So I think I feel more comfortable with this. So otherwise, with so many deputations here today that they take so much effort to come and talk, I think we should take this very seriously. So, of course, we must discuss this conscientiously. Secondly, even with this special arrangement, we cannot end this meeting at 3. So perhaps we can increase the time to 3:20 because we have another item after this. So I hope the meeting will go to 3:20. So when we're talking about joint meeting, that is with elderly care, that starts at 3:30. So our meeting here will end at 3:20. So if you don't have any objections, we'll do this. So I hope that the deputations who have not given us written submissions, I hope that you will give it to us so we can discuss it during our special meeting. Okay. I want to thank everyone for coming. So we'll let the Secretary to answer our questions. 5 minutes, please. So I'll be very brief. So I want to thank the 70 deputations to give their opinions. First, I agree with everyone's opinions is that to understand what is the objective of social welfare, the government feels that we must help the weak in the society. But in terms of how to do it, we have an objective to make sure that we do build a caring and just society, and to make sure that we give the resources to those who need them the most, because resources are limited. So in the government policies is that we must use the resources in a targeted way. You must all understand this. We encourage that those who can work to be self-reliant. This is a very important principle, and no one would disagree with this. Second is that a lot of deputations is that we should have a universal retirement scheme. And second is that the OALA is not adequate. And third is we have not solved the elderly poverty problem. And the fourth is that we don't have planning. So I want to thank a lot of concrete opinions, but I clearly state that the government, even though we do not agree with a 5-year planning, because in the past experience we see that it is really not flexible, but we do have planning. It's not that we don't have planning. Simply in terms of elderly policy, we're saying that elderly people should live in home, and the care center should be a supporting measure. In terms of supporting houses, we should, of course, in terms of care houses, we must increase the spots. So we will increase it by 1,400 spots by next year. Second, in terms of care houses, we must also ensure that elderly people can live at home comfortably. So we must have some services for that, and we'll have such vouchers and some spots for medical needs. So we do have a direction. It's not that we have money each year and then we just spend that money. You must understand that we have a sustainable and recurrent responsibility. So as I've said, we have 1,700 spots to launch forth. It's an example of that. And we have an interaction with the industry. If you look at the policy address, we have 2 main ideas. one is in terms of hardware. We are already taking a step forward, is to proactively liaison with the NGOs, is that if they have land or if they are rebuilding or to expanding, we will cooperate with them. So in turn, this is very important because this is a very concrete and practical step. We must have spaces to have care homes. So, and second, we were flexibly thinking about the funds to help organizations. Third, in terms of the process, we help organizations such as in terms of planning and applications. Those can be very difficult. So we hope to help these organizations, give them some concrete help so that some of the land can be used for care homes for the elderly people so that we can have planning. As everyone knows, this is the most important step. In terms of manpower, we, besides professional manpower, in terms of social workers, physiotherapists, occupational therapists, those are all important. So we also have a liaison with the Education Bureau to have a framework to target train for frontline care staff. So to hope that people will think that it's not just a job, but that there is a opportunity for advancement in the future in terms of those occupations. We also have a review 2 years ago in terms of lump sum block allocation, is that we hope that the industry, as well as especially social workers and others in the social welfare sector, can increase their potential. That's all very important because a lot of industry sectors think that we have no planning, that we only spend money that's allocated to us each year. But that's not true. We always look forward. And we have a very good communication with other bodies in terms of the hardware and software development. So because I only have 5 minutes, I have a few seconds, is that everyone must understand that the OALA is an important support. Okay, thank you, Secretary. Because we don't have enough time, there are 3 colleagues who wish to speak, and I'll draw a line. And then I'll give the Secretary 1 more minute to talk about this. Otherwise, we can't talk about the domestic violence. So the 3 colleagues are Dr. Fernando Zheng, Mr. Albert Ho, and Mr. Leung Yu-chong. So, and then other colleagues we have to speak later in a separate meeting. Dr. Fernando Zheng, please, 3 minutes. Yes, 3 minutes is of course not enough. We're talking about a mid to long-term social welfare review. But I think that the government has not been listening to us, and we've wasted our breath. The Secretary is only talking about targeted spending or self-reliance. It's very funny. In our previous section, a lot of colleagues who want to be self-reliant, now you dismiss them. Now they can't even support themselves. This is a waste of breath. When you're talking about framework or advisory councils, and you say that you have this document for long-term social welfare planning, it's only 4 pages. Only 4 pages of long-term social welfare planning. What is this? I've never seen such an effective government. Long-term planning is that your idea of long-term planning is not long-term planning at all. In fact, there is no long-term planning. There's nothing. And now it's a work procedure. So after the block allocation in 2000, it's already started this. But now you're saying that district levels or central level discussion don't have any records. Let's not even talk about documents to give to sectors. Only those organizations who are invited can give opinions. And only then there was a report from SWAC. But you can see that even though they don't really care, they don't really incorporate the opinions of the organizations in the report. And also these opinions are not reflected in the services that are provided. So in terms of all the measures you take today, they are all just short-term problem solvings. We're talking about human rights nowadays. But when have you ever reflected this in your actual service? When have you reflected this in your documents? These are, you only just saying empty words, and there are no documents. So how can you have long-term planning? So this is a complete waste of breath. In these 3 minutes, I can only criticize them. I have nothing else to do. In the next 2 hours of my special meeting, I can only squeeze blood from a stone. This government is only digging its own grave. In our society, we have so much suffering. And there are so many people who are living in poverty. And the government officials do not care at all. So if we continue this, then the government is just forcing the citizens to rebel. I want to remind everyone that this SWAC was formed in 2006. I was part of the LegCo then, and we did criticize it a lot. So now that the secretary is using the same documents to answer the meeting, I think that this just causes us to oppose you. Next is Mr. Albert Ho, Chairman. What is a 5-year planning? It's saying that after 5 years, what is your vision? What is it that you want to see in the society in terms of carrying out your policy? What are your hopes? What do you want to see to happen? That's what planning is. So once you set an object, and then you're supposed to set some measures, and then you review it every year. So when you're implementing these measures, if you see there's a problem, then you discuss it and then see what needs to be adjusted. That's what you do if there's planning. If there is no planning, what are the problems that will happen? Then if something that needs urgent care, there won't be money or people or hardware. So that's all because there's no vision. So if you see an urgent need and you don't take action, that's what will happen. And we see this in the panel. We see there's so many needs, but the government only gives inadequate measures to address them. A lot of things that we ask the government to do it. Now, the government do not do them, even though they have such a surplus in the treasury, in terms of several tens of billions. Now, self-reliant employers, you want to dismiss them. And yesterday there was an elderly for medical help. The only delay of 2 years. So and then 100,000 of elderly people have to wait. So there's absolutely no target to address these needs. So the government is doing all these measures. Seems like you just want to write a report and submit it to the UN to let them know what we're doing. In fact, they're completely useless, like Christmas tree ornaments. So very simply, if you don't have a concrete response, we must apologize to the deputations. They have so many good suggestions. I hope that the Secretariat will collate them, and the government must answer them in the written submission. Now, the government does not have a vision. For example, we want a poverty line. What do you want the poverty line to be like in 5 years? How many people do you want to see below the poverty line? In terms of RCHs, how many of them do you want to see in 5 years? Some structural problems, such as block allocation. Will you review this? Will you review CSSA, such as the 7-year limits? Will you review this? Such as tax review, buffer tax. Will you do all these things? We need an answer. If you cannot give an answer, then you have to apologize to your deputations and the society at large. Next is Mr. Leung Yu-chong. I want to thank all the deputations to give all your opinions. So I think these are all familiar themes, even though Secretary, you've said that we must discuss all of these. But in fact, we discussed this so many times. Can you please stop for a second? I'm discussing with the deputy chairman. We think that if we have a special meeting next time, if the secretary continue with this attitude, we cannot handle this. We'll just waste our time. So we're thinking right now with deputy chairman, perhaps we need a higher level of the government to discuss these issues, discussed by the deputation. We'll discuss this. So I would like to know how you would do this, actually. So I hope everyone. So, I mean, there will be another special meeting. No. So I know that you've discussed this with us on so many terms, and it's just the same secretary, and then you remain the chairman, so we continue to discuss. So is it that in the next term you'll come back and he'll come back, and then we'll continue to discuss? Is that what has to happen? So we just keep on doing the same things. We all feel very frustrated, but we have to continue. And so we feel that very disappointed. The secretary just repeats his words. So I don't know how many times I've heard the secretary says these words. You say there's limited resources. Who disagrees with you? Of course, we don't want you to take all of the surplus of the Hong Kong government to give it all to the social welfare. Of course not. We all know that there are limited resources. But the question is, you say that you help the citizens in need, but what do you mean by citizens in need? How do you give, or what do you give to these citizens? That is a topic for discussion.
So you're only making abstract remarks. So, Secretary, please do not repeat yourselves anymore. It's just like saying, my mother is a woman. We all know that. We all have to do this. Well, 5-year planning is not just about residential care homes. We're talking about overall planning, your demographic projection, how you're going to formulate indicators and targets, by which year, how many targets should have been achieved, etc., etc. You are being fragmented in your remarks. You tell us only part of the truth, part of the whole picture. We must have a white paper on social welfare. Indicators must be set so that we can gauge whether or not the administration has achieved its targets, so that we know to what extent the administration falls short of the targets. Otherwise, we're only competing in abstract remarks. Perhaps we should produce a white paper on social welfare on our own, that is a public white paper, so that we won't only be discussing an abstract picture. Thank you. Your points are understood. We still have one more speaker, Mr. Chan Kwok-chi. Just 1 minute for him. He has a suggestion. Well, Madam Chairman, I'd like to use this 1 minute to thank the 70-odd deputation and individuals for attending this meeting today. In the past 15 years, we observed a lot of things. Today, we discuss concepts, ideas, pragmatic issues, problems, etc., etc. We've told the Secretary a lot of things. In fact, Secretary, you've heard a lot of them already in the past. I agree with Mr. Albert Ho that we should collate all these issues under various heads. And next time, or before the next meeting, you should give us another paper in response to all these comments and remarks. As for next year's policy address, that's part of the planning process. And then the professors up there will tell us that you need to go back to school. Thank you. Mr. Chan Kwok-chi has submitted a motion seconded by Dr. Fernando Chang. I'll read that out. See whether you agree. Secretary, before I do that, I have to say that with no intention to degrade your bureau. Perhaps it's because of your position that you're not able to do anything. We're not degrading you or your bureau. I find myself a laughing stock. Chung Kwok-chi's motion is like this. This panel requests the CS1 administration in terms of long-term social welfare planning interferes with the progress so that we can have a long-term planning process. This is seconded by Fernando Zhang. Those in favor, please raise their hands. Those against, please raise their hands. Thank you very much. Wong Kwok-kin is not a member of this panel. He is here, but he does not have a voting right here. So thank you. Here I'd like to thank the secretary, the director, and their colleagues, as well as all the friends here. We'll work very, very hard to see how we can plan for the long term. We'll try our very best. Thank you very much. Next item on the agenda, domestic violence. They've waited for a long time, since 1:30 p.m. So I'd like the Secretariat staff to tidy up the venue, and then we'll invite them to come in. Thank you. Colleagues, as we've overrun for more than 20 minutes, this meeting will be extended to 3:40 p.m. and then we'll come back for the joint meeting. Thank you. Welcome, all of you. Welcome, all of you. Welcome. Yes, please take your time. In attendance today, we have Mrs. Alison Lau, Principal Assistant Secretary for Labour and Welfare, Mr. Feng Man-chong, Assistant Director of Social Welfare, Dr. Rita Ho, Principal Medical and Health Officer, Mrs. Alice Low, Chief Housing Manager, Mr. Wong Hoon-keung, Chief Manager for Management, Mr. Matthew Philip James Hemmings from the Police, and Ms. Aoyang Si Wan, Senior Inspector of Police, also from the Police. Welcome. At this juncture, I'd like to thank the deputations. Sorry, as we've overrun for more than half an hour, we've been keeping you waiting. Sorry. Colleagues, before we start with this item, I'd like to repeat that as we've overrun, this meeting will be extended to 3:40 p.m. and deputies and individuals will have to extend this meeting by 20 minutes. Sorry, because we've overrun. Friends from the deputations, due to time constraint, we have to start. Please take your seat. Now, you'll find on the table an earpiece. You can put on your earpiece. Channel 0 is floor. You don't need to touch that if you so wish. Channel 1, Cantonese. Channel 2, English. Can we start? Thank you. Administration, would you please take us briefly through the paper? Sorry, 5 minutes only. Time is tight. On the 14th of January, at the Welfare Services Panel, members and deputations commented on government services on domestic violence. And on the basis of those remarks, we've prepared a response which has been passed to your secretariat before the meeting. In the paper, we will respond to members and deputations' comments. At the invitation of the panel, we've come with other departments SWD, Housing Department, Police, and Department of Health, in the hope that we can further respond to your comments. In fact, the paper covers a lot of details on the batterers, the abused, services provided to the victims, housing assistance, police categorization of cases, medical and health services provided to the victims, etc. So much for my briefing. Thank you, Madam Chairman. Thank you. Deputations, 3 minutes each. Before you speak, I'd like to remind you that your verbal remarks and written submissions are not protected by Cap 382, Electoral Powers and Privileges Ordinance, so please take note of that. Let's start. The Against Elderly Abuse of Hong Kong, the Community Officer for Policy and Legal Support, Mr. Thomas Tsang. What about the lady by your side? Does she need to speak? If she wants to speak, we can take care of that. Madam Chairman, in the administration's paper, everything is mentioned. For example, there's this working group on combating violence, but that's working behind closed doors. It's just like a black box operation. There are no representatives from the victims and the elders. Now, elders have been abused in families, and out in society, they're also fooled around by social workers. If the administration system is effective, we don't need to reconvene this meeting on domestic violence. Apart from domestic violence being neglected, I'd like to comment on paragraphs 17 to 21 in relation to PRH, tenants encountering domestic violence and need isolated residence. The district social welfare officers have been neglected in the whole process. In some cases, victims were rendered ineligible even without going through the district social welfare officers. And then when counselors, media, etc., or even undercover agents are alerted, the social workers will not proceed to help with separate housing. We did assist with organizations and social workers that have breached the rules and regulations. In fact, the paper is saying something, but the government acts otherwise. In paragraph 20, it is said that within 6 weeks after initial application, the SWD will recommend an eligible case to the HD for consideration. Now, what if a case goes beyond 6 weeks? Will the director here promise to resign? In some cases, the elders were abused by family members. So every day they loitered on streets or in friends' homes. They approached the SWD and the housing department, but the social workers asked them to take a form and apply for PRH. And they'd rather fill in the forms for themselves. In fact, the SWD rendered the elders helpless. By my side is Miss Ng, who is 93 years old. In the past 3 years, she was abused by her son, her daughter-in-law, and her grandchild, physically and mentally. Every day she sat on the street until 9 p.m. before she dared to go home, and every day she took her meals separated from her family members, and every day she cried. So, if she went to Che Kung Temple, she definitely got the lowest chip. So please uphold justice for these elders who are abused and help them with PRH. Ms. Ng, would you like to speak? Would you like to speak? Would you like to speak? All right, a few words then. My daughter-in-law bullies me. She bullied me for 2 nights. In 2002, we had 2 fierce quarrels. The daughter-in-law came to Hong Kong in 2006 to deliver the baby, and I got a quilt from the neighbor for 3 years. And then the quilt disappeared. I asked whether the quilt got leaks, and then I got scolded by my daughter-in-law throughout the night. My daughter-in-law came to Hong Kong to deliver her baby. She came, and then after a week, my son took her to Kwong Wah Hospital to obtain certification for delivery. Kwong Wah Hospital did not make the arrangement for her. I have a granddaughter who got married in Hong Kong. My granddaughter is Kun. I say, Kun, your second uncle asked me to queue up at the hospital tomorrow. After some thoughts, I decided not to go. And then Kun's son was born in Hong Kong. She became pregnant. She came to Hong Kong Island. She's familiar with the doctor. The doctor inspected her. I said, Kun, do you have the name card of the doctor? If so, give the doctor a call. My daughter-in-law would also like to get a checkup, so I took her to be checked by the doctor. So 7 days already. The physical examination took place on the 8th. In the morning, I took my daughter-in-law for a physical checkup. As a private practitioner, the examination cost $2,000. We were told that it's not yet time for her to give birth, and then she was admitted to St. Teresa's Hospital. I was scolded. She came to Hong Kong and criticized Hong Kong, said that Hong Kong was not good. And then she said that I tried to kill her. I was very much aggrieved. She scolded me. I felt aggrieved. My grandchild arrived. I said, I'm already old. Why should I scold your son? And then she said that she would kill me. And then I went downstairs to tell the caretaker. The caretaker asked me to report to the police. So I reported to the police station. And the police there told me to see whether she would continue to scold me. If so, I should call the police again, and then the police officers would go immediately to scold her. I live in Yuen-han. The daughter-in-law arrived in Hong Kong in 1996. And then Yuen-han was redeveloped, and then I was rehoused. And then for 10 days, the rent was paid for me. I said I worked so hard to apply for them to come to Hong Kong. Previously, I did not have a telephone. And then I asked somebody to write the letter for me, and then I successfully got them to Hong Kong, the 2 of them. First in Yuen-han and then rehoused in Wong Tai Sin. If my daughter-in-law is good, she should not have scolded me so fiercely. I've been enduring this for over a decade. It's very important for you to come here to say all these today because we have the police and the SWD here, so we understand your situation. In a moment, our colleagues will follow up on your situation. Thank you. Next. Ms. Yuen-han from Serene Court Christian Family Service Center. Thank you, Madam Chairman. Women assisted by us indicate that the ultimate problem is housing. Women abused under domestic violence should get housing. The SWD's policy is to provide compassionate housing to these women. In fact, for those women recommended for compassionate housing, there are not too many of them. Our center statistics reveal that for the first 3 quarters in this year, only 10% of them got PRH, not too many. And in each district, the criteria of recommendation and interpretation of criteria vary from social worker to social worker. And some of these women had to rent premises themselves, and eventually they might not get their discretion for compassionate housing. So here, I think the government should review the compassionate housing scheme, the arrangements, and the usage rate. There should be more transparency and consistency. The mechanism should be streamlined.
Upon divorce, if the title of the PRH unit has to be changed, usually the head of household is the husband. So we hope that the procedure of splitting up the household can be faster. The CSSA rental allowance should also be reviewed because now rent is shooting up. CSSA rental allowance is not enough to help them rent a place. The housing need leads to another issue, and that is the function of our center. Usually when women come in, it's difficult for them to leave because it's difficult for them to rent a place. We don't want our center is only a place or a temporary shelter for them. We want to provide emergency relief. And before they can be housed, I hope that there will be interim housing or singleton hostels so that during the transitional period, they don't need to worry about their accommodation. As regards frontline law enforcers' approach in handling the victims, we have some views. Now the police has a new categorization system. So recently, the number of domestic violence has come down. We are worried that the number does not reflect the reality. We are worried that frontline policemen are less sensitive. In some cases, the women have told us that when they reported the case to the police, their cases are only referred to the emergency center and then to us. So there is a mismatch of service. I hope that this can be reviewed. And now concerning the follow-up work by the domestic violence working group, I want to know the effectiveness of their work. Thank you. Next, Mr. Sam Leung, Hong Kong Chinese Civil Servants Association, Social Work Officer Grade Branch. Thank you, Chairman. I represent frontline social workers. Just now, Ms. Young made a number of suggestions. I would like to talk about areas of improvement in policies. First of all, for compassionate rehousing, we have asked the SWD and Housing Department to liaise so that the means test can be done by the Housing Department. We have talked about these for 3 years, but so far we don't know what progress has been made. Usually, a lot of time is spent in that step. We have to get their documents about their financial means and their passbooks. And for our co-workers, they have not been trained to do all these. When we check the rent receipts and tenancy agreements, sometimes we encounter difficulties. And our bosses will ask us to do repeated checks. And as a result, a lot of time has to be taken. The housing department people have been doing this kind of means test for quite some time. I don't know when this work has been passed on to us. As a result, the approval procedure has been lengthened. And we asked that there should not be 4-tier approval before the case is passed on to the housing department. If we want to give faster help, is it better to reduce the number of levels that the cases have to go through? Last time I said at LegCo that when in a year we have to work on 51 cases and we have to also write reports on custodian. In the past there were 2 teams, but now the domestic violence team has to take care of that as well. Please don't think that this kind of custodian reports must have something to do with domestic violence. In some cases, the divorce is within very wealthy families, and then we have to communicate back and forth with the lawyers, and it takes up 40 to 50% of our workload. So you may not be able to see this part of our workload in the work reports. For the family violence law concerning application for an injunction, why is it that social workers cannot make application for the victims? You may say that usually the abused are adults, but if we cannot do it for them, they have to seek help from lawyers or legal aid departments. And so far, even after legal amendment, every year we can only work on a dozen odd cases. So we cannot really give help to the people. Concerning pediatric, medical social workers, and also the need for residential home places, please refer to our written submissions. Next, Mr. Jimmy, Rainbow Action. From 2006 to 2007, the CU Psychology Department talked about violent behavior among homosexual couples, and only 1.7% of them have sought help from social welfare organizations. Why such a low percentage? First, we want to strive for incorporating homosexual couples into the law, but then the mainstream social welfare organizations were absent during those meetings. Many mainstream NGOs are religious or Christian groups. We understand that many Christian or religious groups are friendly to homosexuals, but most homosexuals see that a lot of religious groups objected to having homosexual couples being protected by the family violence or domestic violence law. And recently, many religious groups staged large-scale events to object to protecting homosexuals by this ordinance. So how can we convince the homosexual community that the religious social service organizations are also very friendly? I think this is not convincing. In the SWD's training, they asked Dr. Hong Kwai-wah to do the training, and he is known for trying to turn homosexuals into heterosexual people. Mainstream social welfare organizations, well, we know that many colleagues like to offer good service to homosexuals, but a lot of problems are structural problems. Many organizations have asked Rainbow Action to offer training to their colleagues so that they can serve homosexuals. But service users don't have the responsibility to feel inclusive. When we are living in the same room, is it true that all of us can be free from any discrimination or prejudice against homosexuals? Ms. Yang Wai, if she enters such an organization, she will be the subject of rumor about her being a homosexual. So what can be done? right now, homosexual and heterosexual cohabitants are being treated together, and that is a natural consequence of this. Many service providers teach service users not to discriminate against homosexuals, but they can say that it is not against the law to discriminate against homosexuals. This is an existing problem. Last time I asked government officials a number of questions. I hope you can give me an answer. Number one, when can SWD enable homosexuals to participate in concerned groups on domestic violence? And when can relevant training courses be organized? And number three, since 2010, after the legal amendment comes into effect, how much resources have the government allocated to service users or victims of family violence in homosexual couples? And which part of the resources are allocated to organizations serving homosexuals, not mainstream social welfare organizations? Okay, next, Mr. Tommy Jai, Rainbow of Hong Kong. This is a meeting of the Welfare Panel. Agenda 6 is about domestic violence. But then, referring to the government's table, it seems that there is no government official working on domestic violence in attendance today. Last time, I asked a number of questions. I don't know whether government officials here can answer my questions. I'm a bit worried. I hope the LegCo can set up a subcommittee on family violence. I have a question for SWD. When will you allow homosexuals to take part in the concerned group on domestic violence? Concerning the appointment of Dr. Hong Kwai-wah, who always wants to convert homosexuals into heterosexuals, well, the impact is huge because the Hong Kong government is the only government in the world handling cases from this kind of perspective. And I don't know why so far the SWD has not apologized. And so far they have not promised that no such incident will happen again or no such course will be organized again. There are 20,000 petitions sent to SWD. I think the SWD has received them. Well, perhaps you didn't expect resentment among homosexuals, but now you should know. Well, homosexuals won't be able to believe or have confidence in the SWD. What kind of remedial actions will SWD take, including making apology? In the past 2 years, Rainbow of Hong Kong had accommodated 37 homeless people. Some have been referred to other places successfully, but some have been rejected. So we're talking about an organization with better facilities, but then people are not willing to go. Some homosexuals are so frightened that they dare not press our doorbell. Sometimes only when we passed by, we saw them and then we offered help. So how can we handle the cases? People are of the view that the SWD is taking the lead to discriminate against the homosexuals. And this will be known to all the homosexuals easily. So I hope SWD will understand that homosexuals will be worried of being discriminated against. Next, Miss Angel, transgender group. Good afternoon, my name is Angel. When I called to the shelter center to seek help, I was driven out of my home when I told my family members that I wanted to undergo the operation and I did not have money to find a place to live, so I have to sleep on the street. And the social workers said that they don't understand what transgender people are, and they were not willing to offer help to me. At that time, I didn't even have a mobile phone. And they said they could not contact me because I did not have a mobile phone. They could not serve me. and I asked whether I could call later, and they said no. They refused to offer service to me. And later I also called to Yuen-han, and at that time I am already sleeping on the street. And as you all know, that organization is a shelter center, is a shelter for victims of family violence. I have been on the street for 2 weeks. Every day I made over a dozen calls. Every time the social workers and the people taking the calls said they didn't understand anything about transgender. And I said, I used to be a man, but I had undergone operations, so now I'm a woman. And they said that they didn't know what to do with me. What is worse is that they had not referred me to any other place. And finally, I found Rainbow of Hong Kong, and now I have settled down. But I don't understand why social workers and SWD can tolerate my sleeping on the street. They just turned a blind eye to me. Why? I want an answer. I said very clearly that I was driven out of home by my mother. I said already that I was already staying on the street. I'm already a street sleeper. My safety might be threatened. I might be assaulted. So, because of my identity, they refused to help me. Now I have settled down. I started to gather more information. SWD and Polangkok have got a domestic violence help scheme, and they offer help to children and women who are victims of domestic violence. Why is it that they offer no resources to our group? And the social workers have not been trained at all to help us. Now, in my group, I have many friends, and my friends have encountered similar things before. The SWD has done only very little domestic violence publicity. Many of my friends didn't know how to seek help. They had been battered for a few months. Thank you. Next, Ms. YY, Women Coalition of Hong Kong SAR. We are also working on family violence, and today it is good that there are representatives from the police. There are a few major areas in handling domestic violence. 1, the police. 2, the ISFC. 3, the shelter centers or relief centers. And 4, victim help centers. Many victims of domestic violence would call the police at the first instance. I want to ask the police, after the law commenced, how many homosexual victims of domestic violence had approached you, and that you had referred the cases to relevant service organizations? At a previous meeting, an SWD rep said that they would not ask about the sexual orientation of the victims. But then I don't understand why. You still didn't know the gender of the. You still didn't know that the gender of the batterer and the abused is the same. If that's the case, I think you have only very little consciousness or awareness of homosexual victims. This is not up to standard. Now we have the legislation. How come you still cannot offer appropriate service? As regards the SWD, what standards or criteria do you adopt to say whether you have done enough in offering homosexual-friendly services? Now there are 60-odd ISFCs. How many of them such that there is at least one frontline social worker who has been trained on homosexual awareness? Besides, within the SWD, are you a homosexual friendly organization? What kind of standards have you put in place to assess all these? I have a suggestion. I want to ask the SWD officials. Have you formulated or have you created an environment that is homosexual friendly so that SWD homosexual staff members can also admit their status frankly? In other words, do you know how many of your staff members are homosexual and how many of them can actually admit their status in their workplace? Because the government, according to the law, cannot prejudice against any employee. I think SWD should allow homosexual groups or organizations to join the working group on combating violence of SWD to offer a homosexual perspective. Every time in LegCo meeting, we had only 3 minutes to tell you how to deal with homosexual domestic violence. You said that you have exchanged views with us on your paper, but what kind of concrete work has been done after such opinion exchanges? Thank you. Next, Ms. Suzanne Wu from Labour Party. Chairman, good afternoon. I am just an executive member, not the Secretary General. In 2011, Ms. Sit Ho had commissioned the Polytechnic University to work on a study on situation encountered by women after being subject to domestic violence and after the passage of the legislation. I want to say to the SWD that domestic violence is not only about violence or abuse of the physical body or mental abuse. Sometimes many women have been isolated. For example, the new arrival women.
So they don't have a lot of support from society. So even if they are going outside of their apartments, even if they're talking about their neighbors, they will have to be controlled by their husbands in such a way. So this is still a form of domestic violence. But unfortunately, even up till now, we see that a lot of government departments or social workers only think that domestic violence is limited to physical violence. So in terms of such strict control, domestic violence, they don't really care about that. So it may happen that they will only take action once there is physical violence. So this is a big loophole in terms of the current system. So I hope that the SWD will take note. And also, because of such isolation of the woman, we find that there are 3 points that must be reiterated here. To handle these situations, we must have a support network for women, that they must have different resources, and so they can help each other to help that these abused women can take advantage of the resources that they have. We have some policies to offer to the SWD. A lot of organizations have mentioned is that a lot of frontline staff, regardless of the police or social workers, they take inappropriate ways to help the people. So we think that throughout all these years, the training is still not adequate because there is still not a comprehensive idea of how to review of what the training should be, what are the problems that are existing. And I think they should invite different stakeholders to do this. I haven't seen such a review, so it seems that they're only solving problems when they arise. So we think that the SWD must have a detailed review regarding training. And what I said can be a starting point. And in terms of social welfare, we hope that there can be a family service center, and that must be subdivided into different specific areas, such as new arrivals. We also see that a lot of women, they cannot leave their batterers, such as they have obstacles in terms of the CSSA and in terms of PRHs. So we hope that all of these victims will not be hindered by such obstacles. Yes, thank you. Next is Dr. Jessica Ho, Director Against Child Abuse Limited. Yes, thank you, Chairman. In society, if there is serious child abuse or perhaps even causing child death, a lot of times we think that it's the fault of the parents. But in fact, there is not enough legislation and services to help these parents to solve these problems. We have 6 points in regarding to how to alleviate the problem of child abuse. First, I think we should intervene as soon as possible in terms of those people who have mental problems, and we see that there was a young boy who was killed by his mother who was mentally disturbed. So I think that has been a neglect in society for these people who suffer from psychiatric disorders. And a lot of times, the children of such patients will be abused in terms of mentally abused. So we think that we should try to, as soon as possible, discern whether these people are suffering from psychiatric disorders, and so we can help them as soon as possible. Second, we hope that there will be a registry for sexual violence, and that will be legislated. There are 35,000 applications for this since enactment for 1 year, and now the applicants also have to pay $100 or so, and they have to wait a month for this. So we hope that there are more resources for this regard, and hope there are more places for this, and that the fee should be waived, and that this should be legislated in order to protect children adequately. And furthermore, all the employers and volunteers who have contact with children should be included in the scope of the registry. Also, we think we should legislate to take care of children who are being neglected. In the past, the government thinks that it was not inappropriate, and that was 20 years ago. Nowadays, a lot of children die because they don't have adequate care, and the legislation is very obscure. In January, there were a lot of cases of children who died because they didn't receive adequate care. So we think that the government should legislate on this. Fourth, we hope that we should have legislation to prevent corporal punishment, because it will harm children physically and mentally. And the United Nations Convention has already been applied in Hong Kong, so we should apply this in terms of the local legislation to stop all violence. Fifth, I think that we should increase the criminal responsibility age. Now it's 10 years old. China and Taiwan is only 14 years old. We should look at the ages between 10 and 13. It is a very special time, and though we should take care of the children, and we should not punish them under the laws. And sixth, we think we should have a special committee for the children. Now, this has been suggested by the United Nations to ensure that the children's voices will be heard. Yes, thank you. And we hope that the government in the September of this year, they will go to the UN. I hope that in this matter, the government will be concerned about this. Yes, thank you. Next, Association Concern for Legal Rights of Victims of Domestic Violence, Ms. Pooja Kapai.
Thank you, Mr. Chairman. Ethnic minority and newly arriving immigrant women are often marginalized and face numerous barriers in accessing services provided by the Social Welfare Department and the organizations assisting them. The general law and service provision mechanisms fail to adequately protect their needs because the underlying assumptions regarding help-seeking behavior and the predictability of what causes of action are acceptable to them are not properly understood. They are more likely tailored for the local population, and immigrant and ethnic minority women have a different set of contextual circumstances that influence what action they might take, and there needs to be greater awareness and understanding of what is it that motivates them to seek out help in the first place, As a result of these circumstances, ethnic minority and immigrant women fall through the service gap and are becoming increasingly vulnerable to being victims of repeat domestic violence. There are 4 key areas of concern I'd like to highlight. The first is the immigration status of entry into Hong Kong. Women entering into Hong Kong on spousal or dependent visas often do not take steps to report because they are worried that the sponsor will withdraw support for their application and they might be separated from their children. Perpetrators routinely use this to exploit the circumstances of the minority women because they know that they do not wish to be shamed by being expelled from the family network. This vulnerability is problematic, and the UK has introduced a domestic violence exception which enables these women to report the incident of domestic violence and then have their visa application considered independently of the sponsor's support. And I would recommend the Hong Kong government to consider a similar approach to alleviating at least one major barrier to help seeking. Second concerns police procedures. When a complainant calls upon the police may sometimes ask to see her injuries, and it is important to bear in mind that the cultural and religious backgrounds of ethnic minority women entail certain sensitivities, and to that end, they may not willingly show the injuries to the police officer. In the course of studies, I have found that victims requesting a female officer to be present have often been denied access, and this may pose a further barrier for such women who may decide not to report the incident the next time. This unnecessarily endangers her life, and it is a reasonable request that can be met quite easily by assigning a female duty officer. Third, ethnic minority women who seek to take refuge in shelters often find it difficult because of isolation and language barriers. They are living in a context with which they lack familiarity. Sometimes there are food or diet-related issues which go unnoticed, and mostly the women do not find themselves able to survive in the shelter. They therefore often tend to go back home to the batterers very soon, and that is because they lack any other alternative option. So careful thought needs to be put into how such women can be made to feel more connected to available resources and how they can be provided with more meaningful options. Finally, there are cluster centers for ethnic minorities around 6 locations in Hong Kong. However, women have reported that they do not find such centers helpful when it comes to domestic violence issues because although there are social caseworkers who can help translate the matters, at the end of the day, the caseworker, who is often an ethnic minority person, would have to refer the matter to the social welfare department anyway. And this leads to a misunderstanding. So I'd urge the government to review the position. Thank you.
好，跟住落嚟係即。
Thank you. Next is Fourth White Caucus, Ms. Ah Yin. Ah Yin, thank you. In terms of domestic violence, we think that victims should have adequate care. If a child have abused physically or mentally, there will be a psychiatrist who can help them. But we can see that actually in reality that is not the case. I am a victim of domestic violence. I have left my ex-husband for 3 years, and I lived in the shelter for 11 months. When I first got there, I remember one time I was talking with the social worker. The social worker never had discussions with my son. So I feel that the social worker did not trust me and wanted to confirm with my son. So I think that a lot of times social workers have not proactively discussed the situation with children in domestic violence. So why is it that those children will have symptoms of mental abuse? A lot of times, the mothers cannot handle the mental problems of the children, so they ask to help from the social workers and then refer to doctors. So why is it that only professionals will intervene when the children's mental problems has evolved to such a point? Is it that our children are not protected under the scope? I think children who suffer domestic violence are affected by this. Let me tell you a concrete example. This piece of paper was drawn by a child. Recently, when some of our friends were talking about how domestic violence affects children, one of the child saw us and then left. the child only knows that we're talking about domestic violence, and then this child took a pencil and a paper and drew this picture, and then in the middle there's a child, and then there are several women on the side. There's several problems driven on the side. One is emotional problem that is affected by parents. They see that the parents are so stressed, and so he's afraid. The second, in terms of character, and so the character is a lot of times affected by domestic violence and cause them to even become suicidal. Third is that the family is always not peaceful, and there are a lot of disruptions, in a lot of times involving the children. Fourth is that because the emotional and character problems, the parents are not, the child cannot make friends, and so in fact become autistic and become discriminated against. This child has never been evaluated by any social worker or have had any psychiatric treatment. This child was left the domestic violence situation for several years. But why is this child still affected by domestic violence in so many different ways? It seems that domestic violence has not provided any care for these children, and so that this child cannot have a healthy childhood. Okay, thank you. Next, out and vote, Mr. Chen, Mr. Billy Leung. Thank you.
Here. Gay, lesbian, bisexual, and transgender individuals or LGBT individuals often suffer from minority stress as a social minority. They encounter unique difficulties, including low self-acceptance, fear of discrimination and prejudice, the stress of coming out and the stress of being out, and the lack of legal protection. All these factors negatively affect the mental health of LGBT Hong Kongers. LGBT Hong Kongers are still invisible in the eyes of successive administrations. Not a single word is mentioned in any social welfare policy or youth policy in relation to this marginalized group. None in any family policy, and certainly not in any elderly policy. Yet LGBT Hong Kongers do exist and have very unique needs. LGBT youth are often stigmatized, isolated, and sometimes left without family love or support. Committing LGBT couples cannot make medical decisions on behalf of their same-sex partners, nor do they have any time off from work to care for their partners. And the lack of accessibility to same-sex cohabitants when faced with domestic violence. Same-sex couples in diverse families, Doi and Gating, lack legal protections, and their rights are not recognized. The parental rights for LGBT parents are more and more the parental rights for LGBT parents, as more and more LGBT Hong Kongers are becoming parents through adoptions or artificial inseminations. The particular family issues faced by LGBT senior citizens, including discrimination in nursing home and senior services. LGBT individuals facing discriminations in employment, housing, immigration, and taxation, and its impact on LGBT families. The social welfare departments continuously refuse to provide any specialized service to marginalized groups and in Hong Kong. In fact, what's ironic is brought up by previous speakers that, in fact, the SWD has invited members who conduct conversion therapies to conduct trainings, and this is rather preposterous. With a population comparable to ethnic minorities, there are currently 5 social service centers offering various services to ethnic minorities with an annual budget of over $20 million. Successive administrations continue to neglect and even ignore the social welfare needs of LGBT communities in Hong Kong. Would respectfully ask this panel to urge the administration to, 1, study and build up understanding on the needs of LGBT Hong Kongers, including youth, adults, senior citizens, couples, and families. Initiate programs to and services to directly respond to the unique needs of LGBT Hong Kongers. 3, adopt and enforce non-discrimination policies covering all government-subsidized and government-run social services. And 4, allocate funds for LGBT competency training for social workers. I'd like to take just a few moments lastly to highlight the news that was in the paper today, whereas a 28 20-year-old female basketball captain who threw herself out of the window today because she's a lesbian. I'd like to take this moment again to ask this administration to reflect on its view on how it treats its LGBT citizens. The continuous ignorance in making LGBT families policy is driving some of these LGBT people's lives prematurely and necessary to an end.
Okay, thank you. 跟住落嚟香。
Next is Ms. Eva Leung, Hong Kong Federation of Women's Centers. Thank you. We provide support for Hong Kong's women for over 30 years, and today we want to say to everyone that we have some suggestions as follows. We hope that the government will set up a group that is led by Ms. Carrie Lam, and to ensure that the relevant policies will be implemented by the departments, because there are a lot of problems that are mentioned today, and I think that it's time that we should have a central person responsible of the overall policy. And we should have a zero tolerance policy to set up this implementation. And on the previous meeting of this panel, there were a lot of organizations that said that the police have some inadequacies in terms of handling these domestic violence cases. A lot of times were not designated as domestic violence. A lot of people are concerned that is it that there's no domestic violence, or is there some inadequacy here? So there's a concern here. So we suggest that there should be a cross-departmental cooperation and a cross-departmental definition of domestic violence, and also to amalgamate all the data together to that we can clearly prevent and handle domestic violence. We hope that all the different departments can have a zero-tolerance policy to set your measures. And
Number 3, concerning the implementation of the ordinance, the application for a mandatory order is an effective tool against domestic violence, but in reality it's difficult to get an order. And some women have to apply for legal aid, which will take quite some procedures. So I'd like to have more protection for the women. The application procedures should be simplified and streamlined to reduce the hurdles for women under domestic violence. Just now, some homosexual deputations already mentioned difficulties in that regard. As for ethnic minorities, they also have special needs. So, dedicated services should be provided to the minority groups and ethnic minorities so that assistance can be provided as soon as possible. As for counseling services for the batterers, resources should be well used. Besides, I agree with other deputations that in terms of housing policy for the abused under domestic violence, there should be more coordination among government departments. And timely reply should be given to the applicants in relation to the progress of the applications. Hong Kong Council of Social Service, yes, our council has a working group on sexual violence. We've set out the details in our 3-page submission. I won't repeat the points therein. Anyway, I'll highlight some salient points there in the hope that the SWD can respond to them. For CT, housing is really a serious problem. With a CSS, say, of $2,000 to $3,000, it's difficult to rent a premises. We heard that in terms of CR, there's huge improvement. It has exceeded $2,000. But then CR is not equivalent to CT. CT is only part of CR. In 2011, on the 30th of November, the administration came up with some figures. CT remained at 400 to 400. So for the abused under domestic violence, did CT increase at the same time as CR? That is worthy of your concern. As for police statistics, as mentioned just now, zero tolerance should be a principle that the government should strictly adhere to. Paragraph 2 of the paper, Strategic Direction, already mentioned that domestic violence should not be tolerated. The administration does not tolerate domestic violence. That's the first sentence. According to police figures, there are only 300 to 400 reports every month. But last month, we only got the average of 48. Well, in just a couple of years' time, the figure dropped by 97.8%, just rounded up to 98%. Maybe there are discrepancies among government departments in terms of classification. So statistically, we need to follow up on the data. So there shouldn't be discrepancies in terms of classification. Zero tolerance is zero tolerance. There shouldn't be any deviation. As for the ordinance, it has been implemented for a number of years. In 2010, Legal Aid Department only received 28 applications. 13 were approved. In that year, there were 4,000 to 5,000 domestic violence cases. So the Legal Aid Department only represent the tip of the iceberg. Next, Association Concerning Sexual Violence Against Women. Ms. Linda Wong. Thank you, Chairman. Our association is committed to serving the victims of sexual violence. So on domestic and sexual violence, we would like to highlight 3 points. The government's paper mentions for sure that there should be zero tolerance for domestic and sexual violence. What's meant by zero tolerance? Only the cases reported or not? In fact, the reporting number to the police is very low. Amongst the 402 women interviewed in a survey in January, a quarter were in households, and only 10% reported to the police for assistance. So that's only the tip of the iceberg. The problem itself is rather serious. Now today we're discussing policy. In order to implement policies, we must master statistics. We've actually got a database. But what about the number of underreported cases? According to the Census and Statistics Department, in 2005, there was a household survey to survey the number of people who reported the cases to the police. Half of the victims did not report to the police. 8 years on, no more such surveys are being conducted. So when you talk about zero tolerance, do you also cover the hidden victims, hidden women victims? So another household survey should be conducted, not just on domestic violence, but also sexual violence. You should examine how many people did not report to the police. For underreporting, most of the cases are rape cases and ethnic minority women cases. And our association was able to detect some of them. In the survey, I mentioned 20% of the cases involve marital rape. Some women were sexually abused by husbands, and if those women refused to obey their husbands, they might be driven away from their homes. They're subject to continuous mental and physical abuse, and sometimes they became pregnant accidentally or even suffered from sexual diseases. And very often they tolerated the situation silently. So suitable referral should be given to them. Next, Rain Lily, Ms. Tiffany Ng. Thank you, Chairman. Rain Lily handles sexual violence cases. In the cases that we handled, usually sexual violence within a household or among cohabitants were covered up, and marital rape is not considered as rape, and very often for cohabitants the woman is raped by her spouse. In Chinese society, sex is a taboo, so it's not easy to ask these women to disclose the details. It's rather unimaginable that rape can occur within the family. So for domestic rape cases, it's even more difficult for victims to seek help. The victims have to handle adverse emotions and suffer from discriminatory attitude on behalf of their family members, friends, etc. People may ask why rape should happen between the husband and the wife. So it's difficult for these women to seek help from outsiders. So we must encourage them to report to the police. Sensitivity is very important. Besides, policies and measures should match reality. In cases handled by Rain Lily, cross-disciplinary collaboration is required. For example, among the legal profession, the police, the social welfare sector, etc., etc. The process of assistance seeking may also be agonizing for the victims. Very often, victims got hurt even in the process of seeking assistance. In 2006, under CEDAW, the United Nations urged the administration to set up a support center, a crisis support center for the victims, to ensure that victims of sexual violence will be given special attention and be served with their identity hidden. And also, in the guideline for medical and legal assistance, a number of proposals are put forth. For example, physical checkup for sexual diseases, and a corner in the hospital should be dedicated for that purpose. At present, such services are provided in the A&E department, which is so busy and is not appropriate for such services. So a one-stop service should be provided. Next, Hong Kong Association for the Survivors of Women Abuse, Ms. Chong Bik Mui. Thank you, Chairman. Today, I'd like to mention follow-up action after divorce and sexual violence. After a divorce, very often there is this matrimony problem. In our experience, in 98% of the cases, the victim failed to get alimony, that is maintenance fee, because the spouse may be very fierce and claims that he does not have the financial ability to do so. And the victim may have to seek help from the SWD, and dignity may be hurt. So a dedicated group should be set up to assist these women victims to pursue alimony. Well, of course, I don't want to see a lot of these women having to resort to CSSA after divorce. Because that may result in cross-generation poverty. CSSA can only meet basic needs. It will not make people wealthy. So there should be a survey on the number of cases in which women fail to get maintenance fee after divorce. And when we sit down with these victims, we discover that there are a lot of such cases. In the pursuit of maintenance fees, complicated procedures are involved. The victim may have to go to the court to apply for this and that. The procedures are rather complicated. Why is it that we let these batterers off the hook? Why should the batterers be able to escape from their responsibility of maintaining their wife and children? As for domestic disputes, I hope that when couples got married in the marriage registry, leaflets should be distributed to educate the couples in relation to maintenance fees, etc., so that they understand their respective responsibilities. Thank you very much. We have 20-odd deputations and individuals today. Colleagues, as the chairman, I have to say or remind you that Ms. Chen Yuen-han had extended the meeting to 3:20 p.m. I can only further extend that by another 5 minutes because we have to hand over the conference room to another meeting. Mr. Alberto, Ms. Alice Mack. And another member would like to speak. Or should we do this? I'll let the 3 colleagues ask their questions first. Then I'll invite the officials to respond one by one. I really have to force you. 1.5 minutes for each member, just for questions. No reply for the moment. Mr. Alberto, very simple, Chairman. I have to thank the deputations and individuals. I agree to many of their remarks. For homosexuals and cross-gender personnel, as well as ethnic minorities, we need special training. And we need support from the government. And we need an alimony council to help with the pursuit of alimony. I have a question for the police. What about this drop of 80% in terms of figures? Is it because the policy had been changed? As there's to be zero tolerance, you have changed your categorization regime or mechanism. So were you incorrect in the past, or have you actually changed your categorization policy? Next, Alice Mack. Very simple. Number 1, I'd like to ask Rain Lily a question. It's simple. In the paper, we see that as far as possible, the hospital authority will deploy a nurse to take care of the victim of sexual violence in a well-protected premises so that there's privacy. And then there's a report on elimination of discrimination, which suggests that a crisis Center for Sexual Violence should be established. So what about this measure of the HA? Can it replace that particular center? Can it replace the Sexual Violence Crisis Center? Next, Mr. Alan Leong. Thank you, Mr. Chairman. First of all, I'd like to thank the 20-odd deputations and individuals for attending this meeting. Thank you very much. Basically, I have 3 questions. Number 1, Chairman, I would like to ask Ms. Ng of Rain Lily, or maybe the government can also answer. Ms. Ng seemed to be a bit worried about those who are in need of assistance. Apparently, she was saying that the center was not providing sufficient and appropriate services to the victims. If I remember correctly, a few years ago, Rain Lily couldn't even get a premises to operate. And then another concern that's similar to Mr. Albert Ho's. That's about categorization, classification, or definitions. Once this panel suggested that arrangements should be made such that it will not be for frontline police officers to do the classification. Well, just now, members' questions are related to the SWD and the police. Of course, the deputations also asked questions about the Housing Department. Department of Health, sorry, since we don't have sufficient time, I haven't heard any question related to your department. So SWD first. Thank you, Chairman.
Excuse me, each bureau or department will have 2 minutes. All right, let me go direct to the point. About training, in the paper, we stated that in the past 2 years, our department provided multi-perspective, all-round training for our frontline workers, including perspectives on homosexuals, heterosexuals, and services for different sexual orientations. We also incorporate new arrivals and ethnic minorities in training for the new recruits. And each colleague in his work will receive appropriate training. I believe NGOs also puts in a lot of resources to train their colleagues. And frontline workers. As regards the sexual violence threat center, this is a service organization not subvented by the government, and based on SWD's policy for non-government subvented service organizations, they have the responsibility to find appropriate places. After the organization notified us, our district colleagues took the initiative to discuss with the hospital authority, hoping that Rain Lily can have appropriate premises. As members know, it is rather difficult to identify premises for welfare organizations. Thank you. Police?
Of offences first. Since 2009, we've changed our classification system, and all cases we call domestic conflict reports. and that's split up into domestic incidents, which refers to arguments, disputes, matters of a nuisance nature, for example. For those cases where there is a common assault or a breach of the peace, we call them domestic violence miscellaneous. And for those more serious cases, such as a murder or manslaughter, a rape, a sexual assault, an assault with a weapon, a criminal intimidation, for example, we categorise those as domestic violence crime. The purpose of having such a system is so that we can accurately reflect the domestic violence situation as it is and deploy the correct resources, utilise the correct handling procedures, and, if necessary, refer those necessary cases to the Social Welfare Department for follow-up action.
好，係唔該晒。
Okay, thank you. Follow-up question?
Is collectively we call all cases domestic conflict reports, but we divide it up into different categorisations depending on the seriousness of the incident that is reported to us and based on our findings when the frontline officers respond to the scene.
But with regard to those cases which you classify as domestic cases, is there any criminal element involved? And would it entail any consideration for prosecution?
Right, not necessarily. If it's a straightforward argument or a nuisance matter, a domestic incident, that may not be the subject of a prosecution. Depending on the nature of the offence and the evidence that we gather at the scene, there may later be a prosecution.
最後一個, it seems to be suggesting that the previous classifications were wrong, such that the previous classification giving rise to 4,000 cases per annum is totally a mistake.
Right. Before 2009, we had two classifications. It was either domestic violence crime, and if there was no criminal element involved, it would be classified as domestic violence miscellaneous. So I'm not sure I can agree that it was wrong. I think over a period of time, as our experience and knowledge in this area was accumulated, we decided from 2009 onwards that the new classification system would more accurately reflect the situation.
好，嗱，我相信咧，
All right. I don't think we can deal with all matters today. Housing Department, Mrs. Law. Thank you, Chairman. Let me be brief. Every year, when the Housing Department allocates public housing units, there are different categories. Our preliminary estimate is 2,000 per year. Based on past records, for compassionate rehousing, there are more than 2,000, even 2,600, 2,700 cases. And in the past few years, there are 400 to 500 cases which are rehousing cases under conditional tenancy agreement. But these may not be related to domestic violence. But then domestic violence may not be equal to conditional tenancy. And why is it that SWD colleagues have to first do the means test? Now, when the government allocates resources, we have to consider various factors. We do believe that when SWD considers compassionate rehousing, apart from other social factors, the applicant's financial position is one of the factors of consideration. So they will do a preliminary vetting. And then Housing Department will make sure that the applicants can satisfy all the eligibility criteria, and we will consider all the public housing unit applications together. Thank you, Mrs. Law. Thank you, government representatives and 20-odd deputations for coming today. I know that today we're not able to take care of all issues that you are concerned about. I have two suggestions. Number one, regarding the police's classification and Housing Department's conditional tenancy, I suggest that SWD can take the lead to fix an appointment with Hong Kong CSS. Together with the other departments, a meeting can be held so that you can iron out things that you do not understand clearly or possible areas of misunderstanding. That's my first suggestion. My second suggestion is, just now, a number of homosexual groups have made a number of comments or requests. I hope SWD can arrange a meeting with them so that you won't have a grudge against one another. I would like to share with you that if the meeting is not successful, please come back to us. We will surely help you. Ms. Mack, Chairman, if a meeting is to be arranged, can the Sexual Violence Center matter be dealt with as well? Today, we are running out of time. Okay, Rain Lily representatives, if you cannot discuss successfully with SWD, please come back to us. Okay, 3 things. Number 1, contact Hong Kong CSS. Number 2, contact homosexual groups. And number 3, the Sexual Violence Center. Okay, that's it. Thank you.